Welcome, everybody. I'll call the meeting to order 6 minutes late, 6:36. Thank you, everybody, for coming. I have to share with you my impulse I have right now to pull the fire alarm. I don't know why, but I'll try not to. But thank you, everyone, for coming. You know, this is an important topic. The town's been working actively on it for 9 months, a year, and I know the fire department themselves have been talking about this for years. And now we've run into, we'll call it a hard stop with St. Mike's stepping aside and sort of forcing our hand. And there's a lot of discussion, a lot of moving parts. So we've got 3 scheduled meetings specifically for this, even though the Selectboard has been working on it, the fire department's been working on it, people outside, we had an active committee gathering information. Renee and the town administration team has been working on this, but now we're getting down to the end. We have 3 meetings. Tonight, next week, and the week after, and there's so much to discuss. We want to focus tonight on one of our options, which is to hire out ambulance service, and we've invited some folks outside and from Charlotte and from Richmond, who have both given proposals to contract with Hinesburg for outside services. So that's going to be our focus for tonight. Obviously, if there's an important question that's related to that, you know, around it, we'll try to answer those. We're upstairs and the sound sometimes is difficult up here. If you can't hear, raise your hand, let us know. We have a microphone, we'll try to bring that around. We're very aware that this room is difficult for everybody to hear, so we'll work hard at doing that. We'll ask some people to come up. And during this discussion, since most of it is focused on the proposals from Charlotte and Richmond, we prefer or insist on large meetings that you address the select board. But in this case, if you've got specific questions concerning the proposal or the service, you know, feel free to say, I have a question for Charlotte, Richmond, for example, about this or that, and we can allow them to answer that directly. Yes, so, is that say? 50, okay. And I've been reminded and to make an announcement to acknowledge St. Michael's service to our town for 50 years. That's quite a service at no cost to us. So, you know, I think that's a round of applause or something. I'd also ask that everybody who's attending, if you didn't sign in on your way out, please at least on your way in, please sign in on your way out, so we have a record of everybody that has been here. Yes, and Tom Ayer is a little late today. He's typically right on time, but he's running just a little late. We expect to see him shortly. We're going to get started without him. Just make sure I've got that. So the first item on our agenda is any additions or deletions to the agenda that we have posted. And I will note that the select board does plan, the last thing we have on there is to consider a motion to go into executive session. So the select board will entertain that motion tonight for a short executive session. That'll be at the very end of the meeting. Typically, that's what we do. And it's nothing to do with what we're talking about next. Are there any public comments besides what's on the agenda, just in case somebody came to tell us about their driveway or something like that? No? Okay, so we will go into the first item on the agenda, and it's review proposals for ambulatory transport services. And in this case, the focus is to look at our option of contracting out service proposals. And I would ask, we have Charlotte here, who has given the town a proposal, and we have Richmond here, who's done the same. They've kind of split the town, and I'd ask them to, one at a time, maybe Charlotte first, if you guys would come up, quickly introduce yourself, talk about your service, I guess, how long you've been in service. Just give us an overview about your organization, too, if that's all right. Yeah, right
here,
right up here.
guest of honor seats.
Yeah. Appreciate you guys coming.
Good evening. I'm Dick St. George, Chief of Charlotte Fire and Rescue Service. This is Fritz Tegetz. He is our Select Board representative and also a firefighter. And Rob Mullen, our head of service for the ambulance. Charlotte Rescue was established, I believe, in the 70s. We run a paramedic level service. We're next door. We put a proposal in that is fiscally responsible, not just to Hinesburg, but to the residents of Charlotte. The best thing that ever happened to Charlotte Rescue is when we went full-time paid and our ambulance comes out the door in 90 seconds. But still, even in places where we are closest to Hinesburg, we're still 10 or 12 minutes away. So you need to weigh that in your decision-making. What we proposed was a split of Hinesburg roughly along the 116 line, including Mechanicsville and CVU, because to also sell this to my taxpayers, CVU, their kids go there. So I have to sell this to a select board, which is Fritz and 5 other guys, and to the taxpayers in the town of Charlotte. We'd love to help you out. Where we go from here is sitting in your court, and it's a very tough decision how you're going to do coverage for the town of Hinesburg. Personally, like I said, when we went full-time paid, it cut our response times down to the going out the door, what, 90 seconds, Rob?
90 seconds, 2 minutes.
2 minutes at nighttime? 2 minutes at the nighttime? When you're in cardiac arrest, which some people here have been, that extra 4 or 5 minutes makes a difference. But it also makes a difference even if we're coming out the door in 90 seconds, we're still traveling 10 minutes to the town of Hinesburg, and so is Richmond. There is logistics in it, travel time, that cannot be changed. So if you want to change it, and go from there. We look at a turnover rate in the town of Charlotte, what, less than 2%?
Last year, we turned over 4 calls to other services. 2 of those calls were fire calls. So our ambulance goes out on every single fire call as well. So for the year of 2019, we turned over 2 EMS calls to outside agency.
Okay.
And that was either because you were already doing something,
We were
covering
already-
somewhere
already
else?
on another call.
Yes. We're not counting the calls where it's a major MCI and you've got to bring 6 ambulances in because you're turning over part of that call anyways, but we're hitting the primary on that call. We're looking at, we run approximately 350 transports a year. We could absorb another 150 to 300 before our turnover rate gets to the point where the taxpayers in the town of Shalott are going to squeak. If we were already running 600 calls a year before this, it could be an issue because there is a utilization of ambulances to a point where if you're in the big city, it's great if you're using it 20% of the time. But if you're here in Vermont, where our turnaround time from Shalott is what, 1.5?
1.5 to 2 hours.
1.5, 2 hours. Hinesburg, we're adding a 25 to 50% increase before our ambulance is back in service. So there would be a tipping point where I don't care as a taxpayer in Shalott that if the ambulance is utilized or not, that it's not available for calls. And when you got to look at your turnover rate, and we're looking at, again, a couple calls a year, if we start breaking the 7, 8, 9% turnover rate, then we have to look at having other coverage. I know the district is now looking at going from 8 ambulances deep to 10 because of coverage problems in some areas, which means if we're busy, Virginia's busy, Williston's busy, South Burlington's busy, then you're looking at an ambulance coming from who knows where, Middlebury or whatever. That's not good for the customer in the end. What we proposed is something we could do with a minimal turnover rate and keep everyone happy in a, well, no one's happy when you're waiting 10 minutes for an ambulance. It's guaranteed. We can be there in 3 minutes and it was, why did it take you 20 minutes to get here? So, your first response does great in town. They're there quick most of the time, but unfortunately in today's world, we're losing volunteers on a regular basis because they have to work 2 jobs in the state of Vermont to be able to live. And I can tell you, fire and rescue as a volunteer is another full-time job.
Can you speak to your proposal as far as a short term and versus a long term, or what the short term proposal is versus long
We are
term?
willing to help our neighbors out in whatever capacity they need within our proposal. It could be 3 months, it could be 6 months, it could be 6 years. I do remember 20 years ago giving Hinesburg a proposal for coverage half the town. And it was definitely less back then, but St. Mike's has graciously covered the town at a minimal expense. These rigs don't run for free. You have equipment costs, you have, what's our AEDs run?
Defibrillator is $22,000 to $25,000, just one.
Just one. You got to keep 2 on stock. We keep 2 fully equipped ambulances, but say we're only running 1. Second one's a backup. It's not going to bang out the door if 3 other calls come in. It's fully equipped. It's there for an MCI, or if the first ambulance breaks down. But with your fixed costs, And with us, we pay 24/7, 365 paid crew year-round. We started the route of bringing in some paid help for the volunteers, and a volunteer EMS running rescue, I can tell you the average lifespan is about 3 years before a volunteer burns out. Imagine working your job, coming here to the select board, doing that job, and then, oh, shit, 7 o'clock, I need to go on shift from now till 7 tomorrow morning. And the average call length is an hour and a half to 2 hours. Now I've gotten 2 calls in the night, I haven't slept, but I have to go to work at 7:30 tomorrow morning. So we found the paid model. Our volunteers actually fill out as thirds to enhance the crews. And unfortunately, that's where fire and EMS is going in the next decade in the state of Vermont.
How many full-time people do you have?
We have at the moment, Rob is full-time head of service. Go ahead.
I've got the whole demographics of the service itself. Right now, we run 1 full-time paramedic. That's full-time for 3 shifts a week. I have 4 per diem paramedics that come in per diem, a shift a week, maybe 2 a week, maybe 1 a month, depends what they're available for. We have 1 that's gonna be testing next month, that's a per diem that hopefully will become paramedic along with another one as well. We have, our total staff makeup is 27 per diem AEMTs, 1 per diem EMT, 1 per diem EMR. We have 7 volunteers that are currently fairly active, and they're all at the EMT rate. As the chief alluded, we don't run basic crews, we run advanced crews only. All of our per diems are AEMTs. We always try to run at least an AEMT and a paramedic, or at least an AEMT and an AEMT, or maybe an EMR or a basic EMT. But we always run advanced life support crews, we have no basics. Last year, as a chief, our call volume has picked up. We did 473 calls last year. That's including the fire calls and the supports and the standbys. As the chief said, we turned over 4 calls last year, which is pretty unheard of. Neighbors, both north and south, are turning over many more calls than that. The other thing that we're kind of proud of is that last year for 2019, we were out of service only for 17 and a half hours. And a good share of that was for maintenance reasons as well. Truck wasn't start, we couldn't get the other one up and running. It might have been in the shop, the other one wasn't available, but only for those, those amount of times. The other thing we started doing back in October is we have a paramedic that's also one of our per diems, that he lives in town. He has actually stepped up and offered to run on duty from home for a lot of times. He'll just call me at night, say, Rob, I'm going on the board with dispatch and with the med center. And since October, this person's put in almost 300 hours of standby coverage. And what that means is if there's a medic, even, it started out just covering for us, but now he's actually covering for the district as well. So when he goes on the board, he calls a med center, and he's a paramedic on standby for the entire district to do intercepts or come in. So if we get a call that he thinks there's something needed, he'll call the crew and say, hey, I'm available if you need me. Here I am. So that's a big plus for us as well, and he's really stepped up, and that's really helped us out a tremendous amount. So things like that. So I think, what the biggest thing I think is we have all advanced crews, and we're full-time paid. And this whole adventure was not or say the Hinesburg doesn't need an ambulance. I think the best thing for the town is they have their own ambulance. Absolutely. You can't beat that with patient care. No matter what, if you go with us, you go with Richmond, you go with one service, you're always going to have that transport or that response time, 10, 12 minutes. Unless you go with one in town, you're not going to beat that. And all we're trying to do is offer to help out in the interim. As the chief said, if it takes 3 months to get an ambulance, 5 years to get an ambulance, we're here to help out. That's all we're trying to do. So.
Can I ask,
Can I add one thing before
Yes,
you ask your
please
question?
do.
Just so you know, the labor pool in the area competes not only with ambulances, but with the medical center. That's where we find our difficulties. The more ambulances out there, You're competing for a limited number of people, and we're truthfully a little on the low side on the pay scale. So if you start hiring, you have to really think about being competitive, because it's robbing Peter to pay Paul. If someone's running a shift in Colchester, and these are the same people, we're hiring people from Milton, Colchester, Essex, Shalott, Virgins, Bristol, these people are going to go where they're getting paid.
We share a lot of them, too.
We share a lot of them.
Right.
Because of the per diem limits on how many hours a per diem can work in a quarter, in a month. You have to look at that. You have to be willing to stomach, what is it going to cost me to have an ambulance? I know it took us years in the town of Shalott to really decide, well, I don't want a volunteer ambulance. I want an ambulance that's coming out the door in 90 seconds. It's great for the first few years, and as you go, volunteers will start to drop off because it is a burden. Chief, what's the AEMT schooling hours now?
Yeah,
Huh?
what was the question?
The amount of hours for an AEMT for schooling?
Couldn't even tell you.
Rob?
160.
160 hours, 180 hours.
After they've already been a basic and been in the service for a year. So a lot of these people go to the hospital and work their 12-hour shifts there, where the hospital bends the rules and is willing to throw money to have the people there. That's where your competition becomes. So it's not Shalott versus Hinesburg versus Williston versus Colchester, but there is a difference in the pay scales in there. But
Can I ask a question? So you've given us the proposal, we definitely appreciate that. Is that proposal all approved by the select board now, or will they need to do that? Because they get in the way sometimes of getting things done, the select board.
It's been reviewed by the select board, and I think from our standpoint, it's not a decrease in service, and it's an increase in income, which is, with respect to the income and the cost, the one thing I might add to these two gentlemen's discussion is that having been on the select board when we transferred from volunteer to paid staff, it seems like every year the cost goes up, and it's just very painful, not only for the board, but for the people that don't understand the cost of transferring from volunteer to paid. So that's an ugly process, and I think my advice would be, if anybody's starting one, would be to start from a paid perspective, because the process of getting from one to the other is tough on the taxpayer. They don't understand because they're not so involved with it.
sell it as one shot.
Yeah. All right, I think we're kind of making this up as we go. I think we'll have the select board ask any specific questions they might have, and then we want to open it up if anybody in the audience has any specific questions for Charlotte, or any questions they think you might be able to answer. So, I don't know if you guys have any specific questions, or do you want to open it up?
We have a question, so.
Yeah, I'm trying to formulate it.
Phrase it.
I can't remember the name of the select board member. Could you just tell me?
Fritz.
Fritz?
Yes.
Okay, so Fritz, you said from the select board's point of view, it's more income and lower quality of service. Is that what you said, a response time, or that's, I didn't quite catch what you said.
Not a significant degradation in service.
Oh, not a significant degradation of service. And you said if it became a significant degradation, like went up above 7%, then you'd have to reevaluate. Am I correct in that?
Yes, and we're judging that point to be above 600 or 700 calls a year. In our demographic area, where a call lasts hour and a half minimum to 2.5 hours, each call takes that. It's not like the call in the city is 30 minutes and you're done.
But just helping us out with this initial proposal, you feel that's doable and it's not going to
Yes,
be a
it's,
significant degradation of your
no,
service to
we're
Charlotte?
looking at, even if we double our turnover rate, we're still less than 5%.
Okay, thank you.
We looked at the numbers from 2017, 18, and 19 for Hinesburg, that had we been on a call, or had we been available and we went to Hinesburg for a call, if we had a call in Charlotte, we looked at those numbers, and it was only like 7 or 8 calls that still would have been turned over in that time frame.
Okay.
And, that we wouldn't have been able to provide service for the town of Charlotte.
Okay,
So the numbers are still very, very low,
good.
so.
When you get an emergency call, do you, maybe it could be a fall or something. I mean, when do you roll the ambulance, or does that go every time there's an EMT?
When someone calls 911 with a medical emergency, the ambulance rolls.
And in the town of Charlotte, when I'm on duty, which is typically Monday through Friday, 8 to 4, I respond with the fire engine as first response. So they're getting 3 personnel right off the bat to a call in Charlotte. While the ambulance, if they're going out of town or they go in town and they transport, then I stay in town unless they want me to bring the ambulance to the hospital or drive them or whatever. But I also stay back, and I can also still provide first response for our members, for our town residents in Charlotte.
Which is also a little plug that if you throw a full-time firefighter at your department that's working daytimes when most of us are at their jobs, that they can respond if they need a third hand on the ambulance, be it my ambulance, Richmond's ambulance, or Hinesburg's ambulance. They're there. If they're not needed, they're still available to first respond until the next due ambulance arrives. That was one of the things we went to 6 years ago when we hired you.
Yeah, almost 6.
6 years ago.
It'll be 6 years.
And as a volunteer chief who works for himself, if I leave the job for every little call, I'll be in bankruptcy court before we're done. So, if that person's available, it adds a third person to your crew, if needed, for the codes, for the large patients, for the ones that are in trouble. But it also leaves you someone back in town if something goes wrong after the ambulance leaves, which we all know. You've got the patient with the stub toe going to the hospital, and the next thing you know, you turn around and you've got a working code in town and your rig's gone. So.
Okay, I'm just gonna make sure, is everyone able to hear? Okay, that is good to know. All right, so what's that?
I have one more question.
Oh, you do, go ahead.
So this is a question I'm going to ask both services, and I've talked to each of you about it. In your proposals, there is some overlapping area, and I want you to speak to that a little bit.
Well, the area we proposed, south of Charlotte Road's a given.
Yep.
The only area that was not our second due to begin with was the Mechanicsville Road CVU section. I'm sorry, kids from the town of Charlotte, not the town of Richmond, go to CVU. And that is one of the ways I can sell it to my taxpayers that we're covering that. They're no quicker there than we are. It's probably, would be a drag race. And our turnover rate is minimal. And I have to, just like you, go in front of my voters and say, well, at least we're rolling in to where your kids are. Richmond has no kids going to CVU. If they do, there are a few minimal transfer students. And that is one of our sticking points. Guaranteed, the Mechanicsville CVU loop. Because if we're just covering south of the Charlotte Road, it's a minimal area. If we're taking the village, it's actually breaking the town pretty much into a 50-50 population split. I know, unfortunately, it would also, if you don't get your rig in service soon, encompass a few elderly housing areas, which are, they pay, but they pay at the Medicaid rate, which is about 40% on the billing. So, again, that would be one of our sticking points right there.
So to also address the overlap that we talked, that I think you alluded to in your email, was that when we started doing the research and the numbers, it looked like it made sense that the village would be for Charlotte, because getting to Kelly's Field and Lyman Meadows, from a patient's response or a response point of view, we're going to be 4 to 5 to 6 minutes faster than if Richmond was to take that. And I know initially we had communicated that we were going to do it half and half. Looking at the numbers, and the response times, it didn't make sense for them to come through the village and come around when we're coming right to 116, and Lyman's Meadow is a minute and a half away. So that's where that overlap happened. Was we initially talked about the border, the Mechanicsville Loop, and 116, and then I looked at it and we were looking at it, and I said we really should have the village. So, and I know you also asked about St. George. That makes sense for Richmond to have St. George if we were to go in together. So.
And just sort of to clarify, as we learn, and certainly I'm still just learning all this, even though we've got people who are either working or volunteering to do the right thing, to help neighbors, save neighbors, do all that, an ambulance is on the side sort of a business, in that there's income that comes in from transports.
You cannot look at ambulance or fire service as a business.
Well, I'm not saying... Go ahead.
The income that comes in helps offset your expenses.
Right.
When you start looking at an ambulance as a business, you want to utilize your ambulance 50% of the time, 75% of the time, but now you're turning over to calls, and we're not in the cities where the next ambulance is 5 minutes away.
I think
Yeah.
maybe you misunderstood me. I'm not
Okay.
saying it's a business. I'm just saying there are business things in the background, that there is income that comes in that helps offset the cost.
Yes.
That income doesn't, you transport everybody, but if they have insurance, there's some income that comes in from that. If it's Medicare,
Medicaid, private
there's
insurance.
a small amount of income. It certainly doesn't cover it by any means, but I think, as you're talking about splitting up the town, that's sort of part of it. Not only providing the service, number one, but then, is this going to impact our budgets, and how much is it going to impact, or is it, are we able to sort of get by and with the percentage of income that comes in versus the cost to do the service. So it's a complicated topic.
It's a very complicated topic. And again, you cannot look at fire and rescue as a business. You must look at the business side of it and do your due diligence and recover as much as you can. Ambulances aren't cheap. They're over $200,000 a pop. AEDs are $22,000 a pop. The drugs cost us money. The time of the payroll costs us money. And the insurance, with what we see in the town of Charlotte, covers a portion of this. We're looking at what, 30%? About a 30% recovery rate on what the cost is. But if you want an ambulance that's there, if you're looking at your own ambulance that's in the town of Hinesburg, if you can recover 30%, it's better than recovering nothing.
Yeah.
Like I said, Medicaid and Medicare is a double-edged sword, because they pay every time, but they pay less than half what the going rate is with insurance companies. So it helps, but it's not, you're not going to finance it on it. I know years ago we looked at when we were getting beat on in the town of Charlotte, while you're going full-time, maybe we'll contract someone in. I brought Golden Cross up out of New Hampshire to look at it, and they're like, yeah, we can cover this unless you got 3,000 calls a year. There's no way we can make money on the billing unless you hit that kind of volume. But once you hit that kind of volume, when your transport times are an hour and a half, you're looking at a major turnover rate.
It's been proven nationwide that, emergency services, especially EMS, transporting EMS is not a moneymaker. You're not going to make your money on it. You might break even if you're lucky. Okay, the money in EMS is doing, non-emergency transports. If you're doing emergency transports, you're not doing it for the money, you're doing it for the townspeople and providing a service for those folks. That's the main goal of it. And when we looked at the numbers and dividing up the town, I was in communications with Richmond. We never, getting the numbers even, so if we had this many calls, they had this many calls, was never in our mind. I looked at patient care and patient response times. But it did turn out, believe it or not including St. George, that if we split it the way that we did with us having the village, it was almost dead even, which I thought was amazing, considering the dwelling units are on the east side versus the west side. It was, it was almost dead even. So our focus was on patient care and the response times, so.
All right, good, thanks. Are there questions? Roger, we might need to get the mic to you. Hold it. No, we need the mic so that they can hear it on TV.
Smile before you talk.
Hey? Would you be balance billing the patients? It's not working. Better? Better?
Okay.
Would you be balance billing our residents for what their insurance doesn't cover? So they have a deductible or something that doesn't cover. Would you then be sending the patient a bill for $500, $600, $1,000 for the transport? Or is this an all-inclusive thing? What you get from the insurance is all you're going to get from us, or are you going to bill us again on an individual basis?
I believe that if the stipend is made, that was made to make up the difference. In the town of Shalott, you will get a bill
So
for
we would
3
too.
bills. Medicaid rules. Everyone gets a bill. After the 3 bills, Shalott taxpayers, because they're financing the ambulance, they're written off.
So you don't go after their house?
We don't go after their house. We do not go after anyone's house.
Okay.
If we have someone from Massachusetts that wrecks their car in Shalott, we're going to keep billing them.
Teach them to visit our green state? No.
I would have to clarify that with my board, but I believe that's where the stipend picks up, the difference that we're billing. That would be my guess. But I would have to clarify that question. But my thought would be, if we're finding out we're not recovering enough to break even, we're going to tell you, well, your stipend just went up. From
Yeah.
So our billing is done through a third agency, so they're the ones that take care of that. And I'm sure what would probably happen is they'd be sent a couple of bills, and if they can't pay it, we're not going to hunt them down and,
We're never going to take someone's
Right.
home, we're never going
Right.
to take someone's car.
so
Shit happens.
we understand people
The
have other
Medicaid billing
issues.
rules are 3 bills. And then we have the choice of either going to collections, which, where does that get you? And writing it off. So,
No, that's a good.
hopefully that answers
yeah.
your question.
That's a good question. I think Zeke had talked about Burlington sends 2 bills out. Then they,
They're supposed to send 3.
Well, whatever, maybe it is 3, but, at a certain point, they don't, that's it. They just move on.
You can't get blood out of the stone. If someone doesn't have something, you're sending the bills, because if you don't send the bills, then you don't qualify for the Medicare or Medicaid billing.
I believe Richmond has a membership deal. You pay so much per year, whether you need the ambulance or not, and you'll never get a bill again. Do you guys offer something like that?
We have in the past.
Losing
It's a losing
venture.
proposition.
Everybody who needs the ambulance frequently pays $100 and you never get the 400 times 4 or whatever.
Yes, yes.
Thanks.
Most of our income recovery is through the insurance companies.
Any other questions? Because we will bring Richmond in and, have them sit in the hot seat, I guess, and give them an opportunity
The
to
guest of
talk
honors.
to us, yeah.
Yeah.
Andrea? Oh, we got to get the microphone.
I just wanted to clarify that the proposal I'm asking is that we would continue to have EMTs in Hinesburg. So those would be the people who are responding today while we're waiting for St. Mike's. So that kind of situation, and we may need to be paying for some paid staff EMTs in Hinesburg to cover the situations that we have today. But the idea that a cardiac arrest, that's going to be dealt with the first responders. And so the situations of the timing, I think it sounds pretty good with this split, but it's clear that we still are going to need to have EMTs here in Hinesburg.
Yes, and I think while these are all just proposals that we're discussing, that would be the expectation. And just so people know, the budget for fire and rescue that we're looking at now, we haven't made a final decision, does include this year a full-time, daytime person because of exactly what you were talking about. That's the real hole we have, is in the middle of the day when everyone's at work.
And today, you could ask Rob afterwards, he didn't realize coming to a small volunteer department, how much stuff wasn't done from people working other jobs. And some days we work his socks off.
Yeah.
And, and like, the lady was asking, this proposal isn't to change anything the Hinesburg Fire Department does. They do a tremendous job, have been and will continue to do that. We're just here to supplement them and
Well,
get your patients.
St. Mike's is going away, and now we have a hole there.
Exactly.
Yeah, okay.
We're just trying to step in and help out and give your townsfolk a place, a way to get to the hospital.
I would just like to speak to Ms.
You
Borganti's
should
point.
introduce yourself, just so.
Oh, sorry,
yeah.
I'm Ed Waite.
Louder, Ed, I can't hear you.
My name's Ed Waite. Just to speak to Andrea's point, yes, in-town EMTs will deal with cardiac arrest, but the only thing that is really going to benefit that patient is getting to the hospital. So the shorter transport times is really the key, even after we've done everything that we can do. Getting them to the hospital really is where they get the next step in that.
Paramedic on scene also makes a big difference.
Yes.
Okay, are there any more questions? And like I said, this isn't the end of the questions, but go ahead.
I'd be willing afterwards if you want to drag me back up here with more
Okay,
questions,
or
so
you
we're
could-
fine.
Yeah, I mean, again, we're sort of opening it up because certainly if people are asking me the question, I don't have the answer, and you guys do,
Well, I've
and
already
Richmond will.
not had one clear answer for you, so.
Is there another question? Okay.
Paul Lamberson. Question, Charlotte, the full-time paid HR org chart. Employees report up through the department and are ultimately paid by the town, workers'
No,
comp.
Shalat is a 501c3, Shalat Fire and Rescue.
Okay.
We work for the town of Shalat on a memorandum of agreement. We have been a separate structure since our founding in 1950. Again, we work on contract with the town of Shalat. All employees are fully covered, workman's comp, everything along that lines. I'm sure you'll find the same with Richmond. We follow the same IRS rulings on per diems, on maximum number of hours. Our employees are covered, our full-time employees have benefits
Provided by the 501c3.
by the 501c3,
By the organization.
the organization,
But not
yes.
by, using
We're-
town
they are
funds, but
non-town.
by the town. By the department.
A good share of our funds are town funds. We're basically mostly financed by the town of Shalat. There is an offset for our billing, an offset for donations, offset, we teach a lot of classes. but the majority of our income comes from the town of Shalott. But we have to meet the same guidelines that you would as a construction business or whatever.
And just to compare apples to apples, currently St. Mike's provides an ambulance, but it's hoped that local Hinesburg EMS has been able to show up first and get on it first. Charlotte doesn't use any volunteer EMS?
Our volunteer EMS on our ambulance are used as thirds, an extra person on the crew.
Out of the station?
Because there's out of the station. No matter who you're contracting with, if you have a heart attack, you better hope those guys are showing up first, because every minute of a heart attack without definite treatment and an AED, which they carry on their rigs, cuts your chances of surviving dramatically.
One more question, and I hope this, I'm trying to word this kindly. What's Hinesburg's obligation to St. George? Do we have, I mean...
That's not one for me to answer. That's
Yeah.
But if I can answer first, your org chart, you asked about the org chart for the organization, did you not?
Yeah.
So about a year and a half ago, we had a major change in the Shalott Fire and Rescue. We became one agency, and so now we have a fire chief who is a volunteer. I am deputy chief. I'm the paid person there, and I'm also serving as the head of service for the ambulance service. So all the rescue employees report to me, and then I report to the chief, and he reports to the corporate board. So.
One question. Full disclosure, I'm an elected trustee of the library, which is a 501c3. Do you folks have a board?
Yes, we do. Unfortunately, our board president was out of state tonight.
No worries.
But
And are
you're
they
looking
elected or?
They are elected. I am appointed as fire
And
chief.
Next question, elected by members of the department or by townspeople?
Most of them are by members of the department.
Great.
The select board has a representative on the board, and we try to fill out seats, the remaining seats of the board, with townspeople, which sometimes getting enough people to volunteer, even for a board member position, much less run a fire truck or an ambulance, is difficult, as we see up here at the board.
Just to go back on the billing part of it, I just got a note from our business manager who is also sick. The billing services that we charge, it serves about 22%, 25% of our budget as far as recoup. That's about what we get.
Okay, so you're recovering about 22, 25%?
Towards yes.
After the billing's all done?
And did she also include the fact that now we have to pay, 3.5%
Tax
to the state of Vermont
yeah.
for tax?
Of course.
Yes. Yeah. They gotta get their fingers in there.
So when they set up the 21 budget, the patient billing covers 22% of that.
Okay. Paul, I'll try to answer your question, but I look for anybody to correct me. So we have we have a contract with St. George now that provides fire and EMT service that we started a few years back. The bottom line is if there was a fire there, local response would come, mutual aid would go anyways. But they do contract with us so that they know we're ready to roll to cover them. And we also provide them a little bit of policing. And it's the same thing, there's a small contract. Again, if there was an incident, we would go anyway. So it's sort of a mutual aid's an interesting thing in that everybody helps everybody, but everybody should be.
It has to be mutual.
It has to be mutual, right. So we've worked with them, and so the thought is we tie them in. If the town was to get an ambulance, we would bring them into that too, which helps spread some of the cost around just a little bit. And if we were to go with the contracting, we would bring them into that opportunity too.
It should also be known that mutual aid for the EMS side is also governed by the district and not by the towns. Okay, so.
The other one thing I want to add is Shalott Fire and Rescue has worked with Hinesburg Fire and EMS for years on certain community outreach programs, the mock crash at CVU. any fire safety issues. Because, again, our kids go there. So, not trying to sell it, we still would.
Yeah.
We roll in with the biggest heavy rescue in the state, and
All right, are there any specific questions?
Couple of questions. I was looking at census data this afternoon for like back to 1980, and like around 1980, Hinesburg. I looked at Hinesburg, Charlotte, Richmond, and Bristol, and Hinesburg was possibly the smallest one. Where now Hinesburg is the largest population as of 2010 out of the 4, and yet every other town has their own ambulance service. So I'm trying to get a better understanding of how it's more worth it to go outside of Hinesburg than it is to have our own with the size of the town and how much the town is growing. It's growing at a faster rate than any of the other 3. And the idea of splitting it, I mean, I live up on the hill. Now, if Richmond's turnover is a lot higher than Charlotte's, does that mean that people that are on this side of 116 are getting better ambulance service than I am paying the same taxes?
can I answer that a little bit?
Sure.
If Shaw and Richmond split the town, if one of us turns over a call, the other one, due to the district, and Richmond can correct me if I'm wrong, is going to pick it up. It's not, oh, I'm going to tone out 3 times and we don't have someone coming. It's if this ambulance is tied up, the next closest ambulance is called no matter what. And that is district rules to even get your license as an ambulance.
And that's what Renee has up on the board now, is the matrix set up by District 3 as to who goes into what town at what number. And the chief alluded earlier that they want to go out 10 ambulances now instead of just the 8. So that's going to be revamped.
And that's a good opportunity. I did want to mention, for those who haven't looked at our packet, which is available online, there's a lot of information in there today about the proposals are in there. There's some cost things, this matrix. There's some data from St. Mike's, the number of calls, their reimbursement success. So if people are interested to get more data to help us make that decision, that data is there.
And if you look at the matrix, both services that are here are already providing services to Hinesburg as secondary or thirds.
Yeah.
And that's all we're looking to do, is continue that.
And if Hinesburg was to get its own ambulance, they would be on there providing service to the other local
Yeah,
towns.
if my ambulance is out of service
Yeah.
or on a call and Hinesburg has an ambulance, to keep their license, they will be responding mutual aid. That is a no negotiable deal with the district.
All right, I think I'm going to ask the Richmond folks to come up, if that's okay. And
Thank you.
yeah, thank you. So on behalf of the board anyways, and the town, thanks for coming. Thanks for providing your proposal. If you want to just introduce yourself and give us a brief overview so we know, who you are and maybe a little bit about your organization.
Sure. So I'm Mike Shirella. I'm the Director of Operations for Richmond Rescue. I've been with the organization for about 13 years. With me today I have Miles Lamberson, who many of you know. He grew up here in Hinesburg. He was a member of Hinesburg First Response. He's been with Richmond Rescue for about 5 years, served as his head of service at Bates College as well, for their EMS department there. And next to me is Jillian Lukowskis, who has been a 4.5-year member of Richmond Rescue. She serves as our vice president. She has her master's in public health, so she's always trying to get her fingers in the data and just getting all the information she can. So as you pointed out, there's really two big discussions. One is whether or not Hinesburg should have its own ambulance, and the other discussion is how to deal with July 1st. And we're very much here just for July 1st, when you need an ambulance. That's our goal, and whether that is for 1 year, 2 years, 3 years, that's fine. And if you're ready to get an ambulance 3 years down the road, that's okay with us. We can back out. We're not tying you to lifetime service. So a summary of who we are. We're also a 501c3, a nonprofit. We have 3 full-time staff, myself and 2 others. And we are fortunate that we have 38 active volunteers who are running duty with us. And we have a wait list currently of 15 people who want to become members, but we have nowhere to put them. Each crew can really only have 4 people on it because we run out of beds at that point. So, and it's kind of like a clown car when you have that many people in one ambulance. So those 38 volunteers donated 24,000 hours. A full-time employee is about 2,000 hours. So that's the equivalent of 12 full-time employees that the volunteers are giving us in their labor. So the volunteers also, it's not just a run from home and hopefully you don't get woken up, it's stay at the station. So you're at the station for your entire 12-hour shift. If there's a call, you're out the door in a minute and a half and responding. So that can be quite a drain on families and people's personal lives to have to be displaced from their home. So we don't just serve Richmond, even though our name is Richmond Rescue, we serve 5 different towns. We serve Richmond, Bolton, Southern Jericho, Huntington, and part of northern Starksboro as well. So we are a regional service. We're used to going to different places, and there's no priority in response. Everybody, whichever call comes in first, that's the one we go to. And then we call in for mutual aid, or we get a second truck on the road if we need to. Last year, we went on 676 calls. We transported 420 patients. And they talked a lot about turnover of calls, and we turned over about 4%, which is still a pretty small number. So we had about 40 second calls, and of those second calls that we were able to take 15 of those with putting our second truck on the road. And then 25 of those we had to turn over to mutual aid. And interestingly, we also give to the mutual aid system. We went out on about 120 mutual aid calls to other towns. And typically smaller services do more mutual aid because they're available more of the time. So it is a balance there, including Hinesburg. We've come over here about, I think, 100 times in the last 5 years. So can we handle more calls? I think that's a good question to ask. And currently, we are really underutilized as an ambulance service. We're on the road about 7% of the time. So in a typical day, that means an hour and 40 minutes. We are out on the road on a call, not available for another call. So that 7% rate is very low. And my guess is St. Mike's, you're probably around 20%, 25%. And a larger, like fully paid professional service, they're aiming to be probably 35, 40% busy. So we have a long way to go up from 7%. And I suspect we could get up to the 15 or 20% mark and still be functional as a volunteer service. At some point it gets so busy that volunteers just can't sleep or can't do anything else at the station. So now in the past 5 years, we've been here to Hinesburg 107 times. So we're familiar with the area, we're familiar with the first responders. We consistently hear great things about Hinesburg First Response. Our members say they're always there, there's a lot of them, they're helpful, they get things done, they hand off the patient with a full report and set of vitals, and it speeds up patient care. It makes that transfer much, much easier. So when you're looking at an ambulance service, we know you don't have a lot of choices here, really. There's just 2 services proposing. But there's a lot to look at, and I don't think it's as simple as what is best for the town. And I guess that's the big question, what is best? And there's a lot of ways to look at it. Level of service is one thing to consider. So we're a paramedic level service as well, just like Charlotte is. We have a paramedic on about 35% of our calls, and we have one of our full-time staff is finishing up paramedic school in the next few months, and we expect that number to go up to 55 to 60% once he is licensed. So cost, of course, that's another thing. We're proposing to cover Route 116 and everything to the east of that at a $10 per capita rate, which comes out to about $35,000, which is about half the rate that we're charging our other towns. And we've picked the $10 because we want to set a sustainable rate. If this does go on for future years, we want to be able to lower the rates of the other towns we cover so that everybody is paying an equal share. And Richmond isn't subsidizing Hinesburg, and we want it to be fair, we want it to be even, so there's really no bad blood between the towns. And one of the other things, one advantage by taking Richmond or Charlotte is that the primary ambulance is typically the one that pays the dispatching fees. So over the course of 300 calls at $35 a call, that adds up to close to $12,000 in dispatching fees. That's part of the fire department budget at this point that would not have to be a part of that. So then response time as well. Response time it's a big topic. And there are studies that show response time matters, and there's studies that show response time doesn't matter. So on a small percentage of calls, those cardiac arrests and things that are very time sensitive, probably the 2% of calls, it does matter. You need to get somebody there with medical training with an AED, and that makes a difference. But for the vast majority of calls, 98% of them, response time is not critical. Much of what we do are pretty minor emergencies. So how much weight you put on response time as being a factor in your decision is up to you. And for $2 million, I can put a station 3 minutes away from everyone's house, 5 stations in town, and we can get you an ambulance there in 3 minutes. But is it worth it? And will it make a difference? And these are the questions you have to ponder.
If you don't mind me jumping in there,
go ahead.
I'd like to underscore the fact that we, in this proposal, it's based on working closely with Hinesburg First Response. And as we talk about these critical calls that are rare but incredibly high acuity, we're realizing that we're going to have first responders on scene from Hinesburg doing exactly as they have done for decades, doing the same thing, initiating care, initiating that extrication, initiating CPR. And Hinesburg First Response is well equipped as an advanced life support service. So we're really lucky to be able to create a proposal that would work in conjunction with that.
And to follow up on the subscription question that someone had asked, so for $55 a year, a household can pay $55 and be covered for any ambulance service. So we'll still bill your insurance, whatever they pay we'll take, but then there is no bill sent to the patient after that. And last year for us, we sold just over 500 subscriptions, which brought in over $30,000, and we wrote off about $4,000 worth of care. So we would call that a win for us. It gives us funding. It helps to take away some of the burden from the towns. And a lot of the subscriptions, people that are on Medicare and Medicaid, they know they're probably not going to have to pay anything out of pocket, yet they do this as a donation because they just want to support the organization. So I'll open it up to questions if there are any.
So I'll ask the same question about billing.
Yep.
You have an outside billing service, and so how do you do your billing if you send out the bill and it doesn't get paid, I guess?
In a similar manner. So Medicare and Medicaid, they have fixed rates that they pay. Medicare will pay 80% of that bill, 20% goes to the patient, and people know that. So they buy supplementary insurance to pay that 20%, or they pay it out of pocket. So of course, we will send them a bill after Medicare pays their 80%. And then with private insurance, you all have health plans, you all have deductibles that you signed up for, and you try to strike the right balance of deductibles and co-pays and all this stuff. So same thing with an ambulance. You have a co-pay for an ambulance. You have a deductible that you have to meet. And we are never going to send anybody to collections. That's not our goal. We are happy to work with people to reduce payments to a reasonable level, often down to the Medicare or Medicaid level. We want to make it so that people don't have barriers to calling ambulances. We want people to know they're not gonna end up in bankruptcy court because they call us.
So, excuse me, I just have one question that goes to the billing. This might go to Charlotte as well. So, the parts of the bills that aren't paid, I keep hearing, oh yeah, well it's part of business and we'll write it off. Would that come, if somebody didn't pay here in Hinesburg, would that bill then come to the town?
Nope. No.
Okay, so.
That's entirely with the person. If we wanted to, we could send them to collections, but we're not going to. So that's just a write-off, a part of business, unfortunately.
Okay, so I asked that question because the the proposals given, you could look at that as a fixed price type of service, right? So there wouldn't be any,
Yeah, the
we
number.
budgeted this and it turns out to be really that.
Right, the number we give, that's it. There is
Okay.
no change. And our average increase from year to year for the last 5 years of the towns we serve is 3%. That's all we've requested additionally.
That would be the same for Charlotte.
Okay, thank you.
Any other questions? So, did you guys have to go to your select board and let them know you were making this proposal, or?
We have not we serve 5 different select boards that we speak
Oh,
to
right,
each year, so
right.
we've been to a lot of select board meetings
Yeah.
this year. Since there has been nothing set, we have not had that discussion with them.
We don't anticipate any issues with that, and I would also like to emphasize that we see this as also a benefit for our volunteers. We hear from a lot of our volunteers that they want to go on more calls. I mean, these are people who are running 72 hours a month generally, so equates to 6 12-hour shifts per month. And it can be difficult to keep your skills up if you're maybe going on a call, a few of those shifts, maybe only 1 or 2, and maybe you're taking a couple high acuity calls a year. So while it's a really kind of bizarre thing to hear that people want to go to more emergencies, I recognize that. We see this as it could be really beneficial for our providers' skills to help them further themselves as healthcare providers.
So the bottom line you're saying is you're probably, even though you're doing several towns, a little underutilized, and so you have some capacity
We
there.
are very underutilized, yeah. So like the small towns we serve, Starksboro, I think was 17 calls last year, Huntington was 70, Bolton was 60-something, and they have a ski area. So it's a lot of very small towns. And then Richmond is the bulk of the calls with about 300, and then the interstate as well.
Yeah, the interstate.
So I just have a question, because I do know that volunteers are hard to get and they're hard to retain. So what is it about your service where you've got a wait list of people wanting to join?
It's taken a while to get to this point. We've really been trying to lead the way with a lot of initiatives in the state. We started using nitrous oxide, the same thing the dentists use that we've been using it on the ambulance. There's a special field unit. We were part of one of the pilot sites in the state. We also were part of the pilot program for high performance CPR in the area, which is now rolled out to the rest of the state, but we were one of 4 agencies to start that. We are a heart-safe community in Richmond, which is something we'd love to extend to Hinesburg at some point. So we have AEDs placed all over town. We have them in our police cruisers there. We have paramedic level service. We have a backcountry rescue team, which has brought a lot of people in who are interested in the outdoors and helping people in the outdoors. It's a really interesting dynamic group of people. It ranges from high school students who are in our cadet program all the way through people who are retired and looking just for kind of a fun second career. And I think that diversity really keeps everybody coming back because we form some really good friendships.
Great, thanks.
So can I ask, regarding your per capita cost, did you include with that some of the overlapping areas that Charlotte is also based their proposal on?
Yep, so that is
right
in our proposal as.
Okay. And in terms of St. George, what are your thoughts on that?
Either service, I think, could reasonably cover it. And again, I don't think response time is critical. 2 minutes one way or the other is not going to make much of a difference in the long run. So either way would work, but we're happy to.
So might that proposal be adjusted slightly if you guys
Yeah.
work out
We
the
have a
overlapping
GIS
areas?
expert on the squad who
Yeah.
can adjust boundaries and count houses and all that stuff, and we can get an exact number of residents that we're serving.
So it sounds like we got the 2 proposals. It sounds like we'll need to, get a sharp pencil and say, here's where the line is, and get a good count on the number of households so that you can then possibly might need to adjust your proposal, and I would think Charlotte too. I mean, so everybody's fighting over one area maybe, but it sounds like it's workable.
Would a 911 call go to,
For the viewing audience.
would a 911 call go to Richmond or to Charlotte? Or does it just go to the center?
So when you call 911 here in Hinesburg, it's going to go typically over to Shelburne, which is one of the public safety answering points. If they're busy, it's going to ring twice and then shoot over to Williston or shoot over to Royalton or some other public safety answering point. And then they're going to ask you what your address is, and they're also going to probably check wherever your phone's coming in from, and it'll pop up on a map, and on that map it shows which ambulance is covering which house.
So nothing will change on that end?
You call an ambulance, it'll come for you. You don't have to worry about which one it is.
And I imagine sometimes our EMTs show up and then they decide they want an ambulance, and I'm sort of curious how that process goes.
Yeah, typically anything that comes in through 911 is anything medical, that they will dispatch everything. Because by the time you get on scene and you realize, oh, this is really serious, you don't want to have to then wait an additional 5 minutes for an ambulance. So we're happy to come out this way and then get canceled part way. If somebody gets there and like, oh, they just tripped, they're fine, they just need a hand getting up. And it happens all the time to all services. So.
Hence the fact our transport rate, or our number of transports is so different than our number of calls, and that's pretty universal among services.
Yeah.
I think it's also a good time to bring up the fact that we only bill, as is the case I believe most services around, somebody's only billed if they're transported. Nobody will ever be billed if we are responding and we're canceled, or even if we make it on scene and we could even provide treatment and then not transport. That person still would not be billed.
So I think I know our EMTs respond to all of them basically, and we never bill no matter what happens. So because we don't transport.
So just to compare response times, we've had obviously St. Mike's for a very long time. Al, what would you say the response time is? Basically about 45 minutes average?
For what?
For an ambulance, if the ambulance comes from St. Mike's.
22 minutes.
22 minutes.
22 minutes is the average.
So I'm just looking at the map you guys drew, so it's fairly comparable, if not less.
We've averaged 16 minutes into the half that we provide backup to in the last 5 years, so.
Okay, go ahead.
Quick question for Richmond. Tell me more about the 2 truck scenario. Are they staffed and ready to go, or the second truck would require people coming in?
It varies. So during the daytime, I work pretty much half-time as an administrator, and the other half I'm on the ambulance tied to the crew. So on those days when I'm not tied to an ambulance, often I'll stay back, do paperwork, go to meetings, whatnot, and then if a second call comes in and I'm available, I'll get on the radio and say, I'm available to crew chief this call, I'm just looking for a driver, and then we'll have a driver from town usually around, often our retired members who will drive down or we'll meet up at the scene.
So you don't commit to keeping a second crew in quarters?
No, it doesn't make much financial sense until you start getting up to like 2,000, 2,500 calls.
And that's those, was it 15 of
40
second calls?
Yep.
So that 15 generally is where we're able to kind of scramble a crew from town and get a driver and a crew chief to take that call. So our goal is to always have our 2 trucks ready to go. And with 1 truck, we know we can get it out the door in 90 seconds roughly. The other truck, if there was a second call, those 40 calls per year, we'll try and get a crew from town.
So I'll ask you guys, and then I'll ask Charlotte too. What's your facility like? That you're, you have 2 ambulance.
Yeah, we have a great facility. We just did a big building upgrade last year that was long overdue. The original building was built in 1996 before any paid staff were even considered. So we had 2 bays, we had 2 bedrooms with 2 beds in each one, and a meeting area and a single office. And we've grown now though to 3 full-time staff and 4 people who sleep there all the time. So people were having a hard time sleeping because of people who snore. And we ran out of office space, so 3 of us had to share 1 office and 1 long desk, which made it very challenging. We were rarely there at the same time, thankfully. So with our building renovation, we added a 3rd bay, which can house like a first response vehicle, much like Med 100. And we added on a training area, so we have all our training supplies and a closet. We also lacked closets when they built the building, which made life tough. So we have that big training area, we have a nice AV system, and the bedrooms now, we subdivided them and made 4 private bedrooms with soundproofing between the walls, so people are guaranteed a fairly quiet night of sleep, barring emergencies. So I think that's also what helps keep volunteers there, because they have a nice environment where they can actually get work done if they're students, or just have somewhere quiet to hang out.
Plus a nice home-style kitchen.
Yeah.
A lot of crews have dinner together and kind of helps with the camaraderie.
And Charlotte, can you guys just tell us, what your facility's like?
Yes, we're fully staffed career building with fire and rescue in the same building. There are bedrooms for the crews, there's day rooms, there's full office and training facilities downstairs, which we hold everything from training for mutual aid agencies to the community through the Heart State program. We run 4 double days, which includes fire and rescue, and the 2 ambulances. So it's a generous station that was built in the early 2000s. So full bunk rooms, full kitchen, full office space for both fire and rescue, full training facilities, full closet facilities. So it's probably pretty comparable.
We also have laundry facilities available for the members. A lot of our per diems are students. We don't have laundry facilities, so we offer that as well for them. They bring their laundry down, do their laundry. And we also have a very well-equipped physical fitness room that they're welcome to use anytime.
Okay, thanks. So there's a couple more questions out back. Yeah, Dawn?
Thanks for hosting this tonight and the process going forward. I really want to, first of all, thank all the emergency responders in the room. My hat's off to you. You train hard, you see a lot of horrible things, and I really appreciate what you do. Couple questions. It appears from the 2 proposals there's a difference of about $15 per capita, and I'm trying to understand what is the rationale for that. And perhaps that might start with what's the annual budget for rescue in Richmond and what's the annual budget in Charlotte?
Yeah, so our annual budget's about $450,000. That includes capital funding as well. We fully fund all of our big purchases way down the road for ambulances and everything else. And I think the difference in per capita comes from just an economy of scale. We are about twice the size of Charlotte, so we get twice the calls, twice the billing revenue, and we have far fewer full-time or any paid staff for that matter. We have just a few per diems who fill in holes here and there, and just the 3 full-time staff.
And what, I know it's not a business, but what's your reimbursement? Do you know that number?
Reimbursement and
for
per call?
Yeah,
So per transport.
or total. You said your budget's around 450.
Yeah,
how much are you able to?
$203,000 is what we brought in last
About
year. For billing, it
200.
averages about $503 per call. So it can go anywhere from a Medicaid call is going to be reimbursed at about 400 and something, up to a private insurance could be 1,100. So.
Yeah. Okay. And so I think the question would be to Charlotte now. Your budget.
So our rescue operating budget is $514,000, with $450 of that being strictly towards payroll and taxes. Okay. To answer the question on the per capita, no, well, that's just rescue. To answer the question on the per capita, is we do not have any contracts on the outside towns right now. So like Richmond has its deal with Underhill and Jericho and Bolton and stuff like that. They're receiving income from them because as a contract fee. We don't have that. And the other reason for making our per capita a little bit higher, again, as the chief alluded to, is that we've got to make it appealable to our residents, mostly because our kids are coming to school over here. So that was the biggest reason to raise our capital up.
So is it safe to say then there's economies of scale in terms of having other towns in a rescue service?
Yes.
Say that again, I'm sorry?
Is there an economy of scale and efficiencies that are realized by having more towns, more revenue in a rescue service?
There is an economy of scale if the state got its act together and did districting with the ambulances where all towns paid a fair amount. But again, in the town of Charlotte, because we're a low volume call, taxpayers would go over a cliff because the ambulance probably would not be stationed in their town. It's a get what you pay for deal.
And I guess I hear very few complaints from the towns. Huntington, Bolton, Jericho, Underhill, they don't have an ambulance in their town. And yet I don't hear complaints, or I don't hear about deaths from poor patient care. So how much does response time matter? And again, the studies are inconclusive.
And then the only other question I had was the utilization rate is very important. And I think you've both said yours was 7%.
7%.
Yours was
Less than half that.
less than half that. Right. And can you explain what that is?
The utilization rate is you take your hours out on call, the hours in a year, and that's as you figured it, and that's when you're out of service, unable to respond to another call. The more calls you have, Burlington can run 600 calls in X number of hours, while Richmond, it takes you 3 times as long because you've got transport times, turnaround times, get back into your district. So a big city can run, an ambulance can run 2,000 calls. It's like Shelburne running 1,000 calls a year compared to the rest of us. Their turnaround time's 20 minutes. You do not have that out here. Yes, you do add a stipend per mile per transport, but that's not the biggest share of your call. It's your level of service provided. Yes, Chief? Same with you as us?
We do some long transports up to 30,
Oh, well, I'm
30
sure if
miles
you're
from
coming from
Huntington,
Starksboro, you get
it's a substantial part, but vehicle maintenance, we spent $30,000 on axle repairs last year on one of our trucks. And it was unpredictable and kind of a surprise to us, but there's a lot of wear and tear on trucks.
I hear that.
Yeah.
I think our budget this year in the fire department is showing a little bit more on maintenance on trucks, in particular, I think because of our hills and, you know, so. Are there any more questions? I mean, yeah, go ahead, Andrea.
How did you pay for the expansion of your
Good
building?
question. It started as about a $300,000 project, and then there was a sprinkler system to be installed and a water line upgrade and a sewer line upgrade. So things got a little higher than we expected. We were fortunate, though, to have a couple of substantial donors who donated $150,000 to the project. We took out a small loan, and we also used some savings. So it's very manageable for us, and we've accounted for it for the next 10 years.
So that's part of your operating budget?
Yep.
Are there any, yeah, go ahead.
I'm Terry Francis. I'm a resident here. I can honestly say I've worked with all of the folks that are emergency services here, and we're lucky. Between the fire department, Richmond, Charlotte, their fire departments and EMS coverage, we're very fortunate in this part of Chittenden County. Not the rest of Chittenden County doesn't have that luxury. I'll be pretty comfortable with whatever you decide to do short term, but I do have a few specific questions, if I may. You both run paramedic services. What's your obligation to the district for paramedic intercepts? And is this town, and the second part of that question is the town of Hinesburg expecting a paramedic service each and every time? So I'll let you answer that, and then I have a couple more questions. So who'd like to take it first?
So yes, we do have a paramedic service, and like I said, we have a full-time paramedic on staff at least 3 shifts a week. We've been averaging about 4 to 5 shifts a week for paramedicine, and also during that time, they are available for intercepts throughout.
So what percentage of the time are they gone on intercepts?
It's so hit or miss. You know, again, we're averaging 1.3 calls a day. Intercepts can be 1 a week, could be 2 a day. You know, I'd say probably 5 to 6 a month. Not a whole lot. Our shifts are 12 hours from 0700 to 1900.
Yeah.
And then we also, right. And then, as I mentioned before, we have that medic that lives in Charlotte that has offered to donate a lot of his time. When he's at home, he will go out and do intercepts and he'll also run for us as well if he's needed.
And for Charlotte, Richmond?
Yeah, so we have, currently we're covering about 35% of calls with a paramedic. Once our other full-time staff is licensed, we expect that to go up over 50%. We provide paramedic intercepts to anyone who wants them, and it turned out to be 7 last year that we provided. So we're kind of an outlier because we're on the edge of the county, so we tend not to get a lot of opportunities for intercepts. We also accept intercepts from paramedics in the rest of the district, so we feel it's very important to be providing them as well as taking them and using them, because it's a valuable service. When you need a paramedic and you don't have one.
Yes, can you describe when that would come up and just sort of, go ahead.
Yeah, I just wanted to jump in to provide some kind of understanding, because I know paramedic and EMT get thrown around interchangeably. We talked about the training hours required for different levels. So in the state of Vermont, and it kind of mirrors the national standard, we have EMR, which is emergency medical responder, EMT, emergency medical technician, advanced EMT, and then paramedic. EMR is about a 60 to 80 hour course. EMT is about 160 to 180. Advanced EMT is another 160 to 180. And then paramedic training is pushing usually in the ballpark of 2,000 hours, including clinical. So what a paramedic brings is really an arsenal of advanced life support that really rivals any small or even medium-sized emergency department. Advanced cardiac life support, advanced airway intervention, such as intubation, a number of medications. So that's that differentiation between advanced EMT and paramedic. And what was that?
Intercepts.
And then so in terms of calls that would merit calling for a paramedic, these are calls where a crew that does not have a paramedic is saying, we really would like some assistance to complete an intervention that we cannot do at our scope of practice. That could be further assistance with a cardiac arrest. That could be the chemical sedation of an aggravated patient. That could be kind of any form of advanced airway.
Pain management is the biggest one. Okay. People with broken limbs that just hurt, and they can give narcotics that can relieve the pain and some other medications.
All right, go ahead.
So, thank you. So just want to reiterate, you folks are not guaranteeing a paramedic on 100% of the calls. That's important for people to understand. That's a very high bar to meet. My agency, we do it 99% of the time, but we're a completely different animal. But that's important to understand. So what I would ask the council is, are you looking for a contract that guarantees an AEMT on the ambulance? Again, there's a difference in training, but there's some medications that A may have. We get the paramedic, that's a wonderful thing, but are we saying that a basic level EMT is fine? It's just a question.
Be an A-level service.
A-level service that we're looking for. Okay, great.
Shaw at this point is either A or above 100% of the time. Usually with probably 90% of the time, it's 2 A's or above on board. Again, with the ambulance services in the area, there's going to come a tipping point with the employees that are available that might not be possible 100% of the time. Right now, we are running 100% of the time, A level or above.
Right. And I'm just wanting people to understand that there's our differences in levels of care.
Yep.
And if what our expectations are as taxpayers as to what we're going to get.
Our medic rate is like similar to Richmond, 39%.
Okay.
For paramedics.
Great. I will say, thank you to you folks. This is a tough job. I've been in your shoes. I'm in your shoes again as with my own agency looks to move forward as we deal with an influx of EMS calls. I will say that if you choose either now or in the future to have the ambulance based in Hinesburg, meaning a town-supported ambulance, I would strongly urge you to get cross-trained dual-role firefighter AEMTs. Why pay for somebody once when you can get 2 services Actually, with a firefighter and an AMT, you're getting 4 or 5 services out of them. So if you're going to spend the money for personnel, spend it wisely once and get the biggest bang for your buck. So I would just ask you to do that. The one other thing I'd ask the town to just be a little aware of is that when you go to look for an ambulance, if you choose to do it internally, think about what your planning and zoning rules are when it comes to assisted living and having elderly people in your building. I'm considered an elder, okay? I have my card. I will need emergency service, although I'll probably crawl there before I call because I'm proud, like most of us in the room. But as we increase, and this happens in my agency, as we increase in age, the demands for emergency medical services is higher. And it's higher because our healthcare system screwed up, and we won't even get into that. But that's just something to be aware of. I know I have 8 assisted living facilities in my jurisdiction, and I know that they generate about 28% of my calls. They generate 46% of my advanced EMS calls, and they generate about 7% of my severe paramedic level requirements. So that's just something to be aware of as things go. So thank you for taking the time to do this and just putting up with some old guy talking.
Thank you.
Terry, you're one of our neighbors down as well. Would the proposal be coming from your department?
No.
Come on, I saw you talk out there. You're up.
Actually, and this leads to a bigger question, and Don asked the question very nicely, is really in the area, in South Chittenden County, we may be ripe for regionalization of a whole bunch of services, public safety services. And we would all be remiss if we don't start talking about that, because it's really going to take about 10 years to do that. But it's not necessarily cost savings, to be very honest with you. It is not cost savings, but it delivers a much better service. As I said, I've had the opportunity to work with pretty much every firefighter and first responder in here. We are very blessed, and we may be coming in the near future looking at a more regional approach for police, fire, and EMS in South Chittenden.
If that's the case, should that sway our decision to go with or without the ambulance?
No.
Yeah, I think from, what we've heard, and again, we're just rookies here, just trying to understand the very complex subject, is that any regionalization, as you said, is, many years away, even though that's where, we all seem to think that that's a good approach. It would take years to get there. Are there any more questions specific really to the proposals and the service option of contracting out?
Yeah, I got a quick question. I'm Lucas Charbonneau. We heard Chief over here talk about the importance of response time. We heard Ed over here talking about the importance of response time. I hear you over here telling me it really doesn't matter. As someone that's been on the other side of this circle, I tend to think it does matter. So can you explain to me, I'm kind of looking at this whole situation as like a job interview. They're kind of pitching us what they're talking, you're pitching us. Why are you telling me that it doesn't matter, and why should I go with you over them because it doesn't matter, or because they do matter? They're telling me it does matter.
I don't think you're wrong in that. I mean, it does matter. You want to get help somewhere. When you have an emergency, you want someone there to help you. What I'm looking at is the patient outcome, how people end up at the end. So is there a difference in how people end up after they've been to the hospital and they get discharged? If there's a response time that's less than 10 minutes or greater than 10 minutes. And it turns out there is none. And there's always going to be 1 call, 2 calls where it does make a difference. And that's statistics, where sometimes it works out, sometimes it doesn't. But in the bigger picture of an entire town, you have to do what's best for the town. And part of what makes this work in Hinesburg is because first response. You guys, I think I saw a 3 to 6 minute average response time. That's incredible. And that's what matters. Getting the AED to somebody in 3 minutes or 6 minutes, that's what saves somebody. And whether the ambulance comes 4 minutes or 8 minutes down the road, it's that first responder with the AED that's going to make a difference. And all these studies that we look at that either it makes a difference or doesn't make a difference also accounts for first responders being there. So they're an incredibly valuable part of this. And coupling these two systems together can make a great impact for patients.
I would like to also add, just to respond, as we talked about, I mean, the reason that we can put a proposal in with good conscience is because Hinesburg First Response exists. This wouldn't make sense if we're saying, we want to provide service and we're going to be the first ones on scene. I acknowledge that completely. The life-saving intervention that's going to happen in those first few minutes of a call are going to be provided by first response, like a cardiac arrest. It takes time to get a resuscitation started, and in the state of Vermont, our protocol says for the majority of cardiac arrests, it will be worked on scene for 20 minutes. And that is based on the fact that it's really hard to run a good cardiac arrest in the back of a moving ambulance. And the best thing that we can do is give the best compressions and best ventilations possible. And it's really hard to do when you're bumping down the road. Hence the fact we're working these on scene for 20 minutes with very few exceptions there. Furthermore, and I think back to my time on Hinesburg First Response with all of you, there's an opportunity to get that patient assessment done, get those initial treatments started, get that patient packaged. And ideally, when that ambulance shows up, be it from Charlotte, be it from St. Mike's, be it from Charlotte, in the past, be it from St. Mike's, be it from Richmond, or be it from Hinesburg in the future, you can have that patient packaged and ready to go, put them right in the ambulance, and that ambulance can head right off. And I don't think it's going to add any time compared to an ambulance getting on scene, initiating treatment, having to extricate the patient, package them, etc., and then get them in the truck.
I'm Lynn Porter. I'm a volunteer EMT, and I just have a clarification question. Whether it's an ambulance for the town, in town, this year or 5 years down the road, when you all started your squads, we're hearing a lot about paramedicine. Were your squads paramedic level squads when you started them, or did it build as you built your department?
So paramedicine was not available in 1971 when we started. It wasn't available to the county until 10 years ago because the medical center controlled that and they didn't think it was a priority. So we've been a paramedic level since the beginning of 2016. We plan to stay that way. It's really provides the best care for everybody.
We started using an old hearse and moved up from there.
Greg Matthews, live in Hinesburg, walk your sidewalks. And you know the rule. Just so you know, I've told Al if he sees me face down, go to Papa Next and have breakfast. But anyhow, I heard Tom say that St. Mike's average is 22 minutes to get here. What would be your average to get here? If you did your...
With good roads and, summertime response, we're going to be here in about 8 to 10 minutes.
8 to 10. Richmond?
16 based on actual data in all weather conditions, all times of year, middle of the night.
So both towns, both of these towns that are offering support are offering to come quick from the city.
Average, yeah.
Average, but we don't want to weather. I just wanted to have those numbers out there so people would.
I'd say about 10.
10 is,
that's the number straight across the village.
St. Mike's is served as well with 22 response time.
Right. Right. The thing to remember is it's divided up in quadrants.
Yep.
So a lot of their response times are based on in their quadrant, not townwide. Because they don't do townwide.
All right, I'm gonna start to bring it back. So if there's a couple more questions, because the board does have more information, we're not gonna make any decisions today on this. So we'll get to those questions and we're gonna have to move on. Go ahead, Andrea.
You had a map up there which was E911 households, but we're talking about per capita. And so I want to understand whether the billing is going to be per capita, but from looking at it, it doesn't look like there's quite the same number of households in those. So I just wonder if anybody has looked at those details.
So we can count residential units. That's based on all the state mapping data and figuring that those are where people live, and then just take the proportion on each side and assume that the population is then split evenly.
When we've started to look at this, it is per capita, not residentials, if that's the question. Are there any more specific questions for Charlotte or Richmond too? That's what we're looking for. Go ahead.
John Lyman, can you explain if and how the EMS level affects billing?
So I could go on for a while about this. I'll try to keep it brief though. With billing, we can bill 3 different rates. BLS, which means basic life support. So you might have a paramedic on the call, but it's for a stub toe. That doesn't require a paramedic, so you may only be able to bill at the BLS level. There's ALS 1, so that's something like a chest pain call, where it could be a paramedic, it could be an advanced EMT. They do their assessment, maybe they give a nitroglycerin, give some aspirin, start an IV. That could be billed at ALS 1. ALS 2 is the highest level we can bill, which means you have to push 3 intravenous medications separately, have to do endotracheal intubation, manual defibrillation, a whole list of things that qualify it for that. And with Medicare and Medicaid, they set the rates. So BLS calls, of course, you get less for those. ALS 1, a little bit more. ALS 2, even more. And then private insurance as well has the same billing scheme. And we find the ALS 2 calls, there's not a lot of them. It's probably 10%. ALS 1 and BLS are split fairly evenly.
That's universal, how it's done?
Yeah, that's how ambulance billing is done.
Bill, Dave Esty.
Yeah, you should use the mic just so.
I'm assuming, since neither one of you mentioned, you're not going to put an ambulance in our station. Nope. And which means you're going to be requiring,
Let's ask the question so
you
we can
are
keep
going
moving on.
to be relying on our EMS services in the future, our first responders, which, for everybody to know, that is going to increase our cost that we're going to be paying out of our pockets along with to them, because our calls are going to go up. So the $30,000 a year that we're spending on EMS right now is going to continue to be a larger number in the future.
Because of the call quantity.
Because the call volumes.
Yep, call volume's gone up, yep.
Whatever, yeah.
And call volume would go up regardless of
that's
what's
a
happening
fact.
with the
That's
ambulance.
a fact. Yep.
You use more supplies, you need more training as people get more experience.
My point was that our expenses are still going to go up.
Yeah, so
in the
I
future.
think your point is, even if we contract out the ambulance, that doesn't reduce at all our EMT, right? Okay. Yep, and we know our call volume continues to go up, and, you know, part of this whole discussion, or at least the board is looking at this, I'm sure everybody else, is we're expecting, first of all, even if we didn't grow, our population's getting older, that causes the call volume to go up. And then, you know, with some of our expected growth, including elder care specific buildings with, for older people, then we expect, as it was brought up before, the percentage of calls from that is higher than a normal resident. So we're not just looking for, because St. Mike's has left, that has caused us to sort of stop and really take this seriously, even though the fire department's been telling us about this need for a while. At the same time, we know, you know, that the town's call volume is going to go up. So what service are we going to provide? And how much does the town want to, what service do they want, and how much are they willing to pay? I mean, that's what it comes down to in the end. And while we fill in this spot with St. Mike's going. So with that, if there's any more questions specific to this, go ahead.
Yeah, I'd just like to thank everybody for coming tonight, and we were, I know, I'd just like to thank everybody for coming out tonight to get the information, and for Richmond and Charlotte being here to talk about it, and we're gonna keep working. Thank you.
Thanks.
Go ahead.
I just think one thing that you said is no matter what happens when you guys go with your own ambulance, you pick Richmond, you pick Charlotte, you pick both of us, whatever, no matter what's going to happen, and I speak on behalf of Richmond, we're still going to provide mutual aid to our neighbors and help them out, no matter what happens with this whole, proposal.
I would say, coming to this meeting, we knew it was going to be well-attended and potentially contentious, but it hasn't been at all. We appreciate everybody, allowing the information to get out there as we try to absorb a very difficult subject. We look for more input, and I certainly walk away looking at these first responders, the fire responders, the local people in our local towns, knowing that if on the way home something happens to me, there's a bunch of people that they don't even know me, they're going to come and help. So that is, I walk away with a really good feeling. What they say. So thank you very much. We will meet again next week and continue this conversation. Thank you. Good. Thank you. So we'll take maybe 5 minutes to settle out. So thank everybody for, going through that process, and it seems like everybody felt more informed, and it seemed pretty good. So thank you for that. Next item on our agenda is a discussion of possible next steps on the March bond vote for wastewater. And I'm going to pass this off to Renee. It's a lot happening in the background, so, and this is just really an update.
So as you know, we did the household income survey. We had hired the consultant, RCAP Solutions is the one that conducted that survey. The results came in. Our median household income exceeded the amount that we could qualify for any of the USDA grant funding. So I've been on the phone with USDA, our consultant Aldrich and Elliott, who has also been reaching out to the state. At this point, because we don't qualify for any of the grant funding, we are putting the USDA application on hold, on pause. And so now we are checking with the state to see if it still makes sense to go to a bond vote in March. We're waiting for that, the final answer. I was hoping to have it before this meeting, but I suspect I'll hear tomorrow. At this point, it's what we're trying to tell the state is it's really going to be hard to ask our voters to vote for something that there is no guarantee. The grant funding was at least going to take a portion of it, and now that we don't have that going toward it, it make more sense to wait for the bond vote. In the background, the state is also, there's been a lot of communication happening and a push to look at towns that are experiencing hardship like Hinesburg in the situation they're in. And so there's conversations about directing some other funding towards it. Those conversations are going to take a while, and so likely won't have any answers to that until the spring, which is another reason it makes sense to perhaps delay this bond vote. But again, it's up to the state to decide that, whether or not we're going to have to, and then I will be asking you as a board to either, if they say we don't have to, you'll just have to make an official decision whether or not you're bringing it to a bond vote in March. So by the next week's meeting, I should have clarification on that, but just stay tuned. There's a lot happening in the background on that topic.
So the good news is we got enough people to do the survey. Yes, thank you, Joy, for leading that. The bad news is we don't qualify because the incomes are too high or not low enough or above the threshold. Then maybe the good news is there is some things happening in the background at the state level looking at possible use of some funds to help towns like us, and I think our consultants are, doing that work, helping us with that. So does that sound?
Yep, and there are outreach to representatives, that they are also continuing that conversation, so, the combination of all of it definitely has the state's attention, and they are looking at.
So I'd like to try to reword what you said in my own simple words, and you tell me if it's right. If we put it to a bond vote without any funding, that's a big price tag.
Yep.
And that's going to be really hard for our voters to swallow. But nonetheless, the state may demand that that's what we need to do because the state has demanded that we need to build this wastewater plant. So they may say, doesn't matter whether you have any funding in place, you just need to go through.
It's possible.
So
It's
that's
possible.
what you're waiting to hear.
We have to wait, yes.
And who is it that tells you that?
So, right now, Wayne Elliott is in communication with the state. He's waiting for.
But when you say the state, who do you mean? Is it Department of Environment?
Probably A&R,
Yeah.
but there may be some other folks involved in that too.
Right.
Okay.
So we're waiting for that.
It's kind of bubbled up a little bit, which is good.
But it
Yes.
sounds like somebody makes a final decision. I'm just interested in who that is.
Yeah. We will, I don't have the person's name right now, but yes, there is a conversation. Like I said, I will likely hear something soon.
Okay. Interesting.
And if we show no opportunity for funding and we're asked to go forward with the bond vote, one, it would be hard to look at the select board members and say, are you all for this bond vote? And, I'm not sure what the answer would be. And so we'll see what happens.
I think that we have been proving to the state all along that we've been doing our due diligence and we've been following, so that is to our credit. And I think the state will seriously consider that, so, yes.
And what the state might say, you must go ahead, or the state might say, well, we'll give you more time, like another year, because you may be able to find more funding?
So, yes, ultimately, we will still have to, do this. It's just, if they give us more time, that will also allow them more time to have the discussions that they're having and determine, are there additional funds, or is there some loan forgiveness that they're going to be offering towns that are experiencing hardship or will be experiencing hardship based on these.
There's some money in the Clean Water Fund, and now they're going to battle over how they spend it.
Right. But who is they?
The representatives are in session, so they're going to be part of this.
That's what I thought. Yeah. So there are several different entities involved. There's the ANR and probably the DEC and probably some other initials, as well as our legislative representatives.
Right.
So I think we'll know more by next week.
Okay.
So it sounds like Aldrich and Elliott, that's our firm. Being, if I understand right, the Clean Water Act that came from the state to us is something that came from the federal government to the state, correct? So are they also looking at federal level funding and talking to the representatives at that level?
USDA. Probably not. The USDA was the only thing that's out there that, so.
There's other different sources. The USDA was going to be the grant funding that we were looking at. There's still the pollution control grants, and now there's, that we're looking at, going to have to explore some other options too.
So is there anything we can do, or are we just kind of?
I think we've been doing what we need to do. I think that the more that people be reaching out to the representatives, that's always helpful. So I think just to keep Hinesburg front and center in their minds is going to be helpful.
Okay.
I was kind of thinking just now, does it make sense to hire an advocate? A lobbyist at this point, because it's just completely unfair.
we've discussed that, but I think there are things in motion right now that are looking more promising. So we need to stay tuned and keep asking questions, keep reaching out, but I think there are conversations that are definitely happening, and they have Hinesburg in mind as well as any other communities that are in similar situations.
That's good to know. I want to make sure that we don't miss a thing.
Right,
When it comes to reaching out, because the session is short and people get pulled from every direction.
Right.
But this is a serious issue that we have here.
Definitely
Very
a
serious.
issue. Yeah, absolutely.
Yes?
So I have a couple questions. I've been thinking about this a lot. And the survey went to the users of the sewer.
Yeah.
Did it go to the people in Triple L? Because they're only water users. And so I think, right?
It could only go to the people in the sewer service area.
Right, but I think that when it gets down to thinking about the whole budget for the water and wastewater department, it's unfortunate that somehow we couldn't make the case that, well, and this will probably come into effect in the operating costs, but in the end, you know, if you look at the users of water and wastewater, some only water, some only wastewater, I think we would find that we might qualify for that USDA grant. And so I'm just wondering if there's another way, if we get another chance to go on this, if we could do that, because it's crazy.
Unfortunately, it wasn't up to us.
Yeah.
It's directed by USDA and how it has to be done. So even if we were to do it again, we still have to go by the rules and the guidelines.
I think when you're considering, and then that's the other thing, is like, has there been any calculations done on what this is going to do to the rates?
Yeah.
We've done some back of the napkin.
Yeah.
But that's our consultant is doing that in the process
And
too.
we need that.
Yeah.
So roughly, with what we potentially could get for some grants, real quick estimate was double the rates.
Right.
What the rates are now, double.
Right. And those, and double the rates to just cover the bond.
Yes.
But then
Then there's additional, we know there's some additional maintenance costs, another 25% or so.
Right, another employee.
Yep.
Potentially.
Right.
And so because we have a water wastewater department, those costs are then either we're gonna have to start really separating those so that the water users.
I think legally, we should be making them really clear. So as they get bigger, you need to make them even clearer.
So I mean, it's really gonna be unfortunate that this cost is going to be really borne by the people who are just water users in the end. Because unless we separate these departments, and you can really classify which employee is.
So we have some shared expenses.
Yeah.
We have it done by water, wastewater, and then there's shared expenses that.
Right, but if we're saying the water people are paying for wastewater, we're not doing the job of separating them correctly.
Right.
Right. Yeah, it's hard.
Long enough to know how that happens.
Yeah.
Can you share what the median household income was?
It was like 64,800.
6,700.
And what did we have to come in at?
About 55.
Okay.
I think at some point we'll need to do something in Front Porch Forum. We don't necessarily need to do it tomorrow.
Right.
But to say, thank you for everybody, for doing it.
Mm-hmm.
And, it'd be nice, maybe we'd wait a couple days till we have some other good thing to say along with we didn't qualify.
And is it my understanding that if a bond vote fails 3 times, then the state would start fining us?
Well, yes. However, if we've been doing our due diligence all along, and because of these circumstances, there's possible, they may take that into consideration. So those are questions we're going to be asking, especially because of the situation we're potentially in right now.
So I just would like to offer this, and I know that, you know, you've discussed it, Tom has brought it forward quite a bit, that wastewater treatments throughout the Champlain Basin are being asked to do these upgrades, and yet it's 3%
Right.
of the total that the feds are making the state meet the total minimum daily load for phosphorus. And, you know, what's happening right now at the state within the Department of Environmental Conservation is they are trying to come up with a formula for what kind of practices can be done that will reduce the phosphorus loaded.
Outside of the wastewater treatment.
Outside of
plants.
the wastewater. So, because they recognize that even with doing all of these mandatory regulated things, like the sewage treatment, like our municipal roads general permit, the other things that are needed, that is not going to get us to the level that EPA is requiring on the lake. And so, you know, they thought, well, that 80% was going to be met by regulations and 20% is going to be dependent on voluntary compliance, which that's what they're making a lot of this money available for. What I'm hoping will transpire during this period of time, and maybe even in the legislature this year, is that there will be some recognition that there may be a much more cost-effective way to deal with this when they come up with these formulas. And I think we are extremely well positioned here in Hinesburg to demonstrate that there's multiple ways in which we can reduce our phosphorus loading.
Other ways to spend the money that
other
are more
ways to
effective.
spend that money
Yeah.
that will have multiple benefits. So I think it's really important that you're continuing with, you know, doing the due diligence and doing the engineer, because, you know, we have to do that. But I think the legislators need to recognize how this is such a poor bang for your buck.
Yep.
When we could be just doing projects that are, you know, going to have
More cost effective.
more
Yeah.
cost effective, and have multiple benefits. You know, not just, you know, putting a bunch of technology out there and needing tires.
Andrew,
Okay.
will these practices also reduce the nitrogen? Because that's...
Well, yeah, I mean, I think there needs to be a look at that. And until push comes to shove, nobody's gonna be doing that, so.
So I think
It's-
we know that.
Yeah.
and Yeah. So,
Okay. Good.
we've been educated, I think. All right, so I'm going to keep moving. The next item is the budget reviews. We were looking at highway. The Community Resource Center has made some slight adjustments. We'll have a discussion about salaries, health insurance, and other things. And primarily, you'll be leading, I think, most of this. Some of the changes you've made, I think.
Sure. This is responding very slowly, so I think when they thought I was shifting too fast during the thing, it's just
Yeah.
because this is not responding correctly.
So we had an updated budget.
So what's in the updated budget is reflective of our conversations at the last meeting, as well as, you know, just kind of continuing to go through it and look. So let me just get here. All right, so the things that are highlighted in the FY21 budget column are changes that, you know, I've made recently. I think in the select board, I think those were reflected the last time we talked. One thing, the election salaries. So I've been meeting with each department head, kind of really talking about the salary line. We reduced the election salary slightly. And going back through, really looking at wages, where the pay rates are right now, making sure that we have the right figures going forward. So I've spent a lot of time on that. I haven't, right now this is reflecting Obviously, all of the union police have the 3% or what it was agreed on there. The other wages are at 2%. Currently on the highway, because their request had been for an additional employee to bring them back to the where the staffing level they were at 20 years ago. That was one area you guys had talked about last week, and it didn't sound like you were all in agreement about moving to having that 5th position. Currently, what is in there is reflected of the 3% increases that a union get, as well as right now, I just have a placeholder of an extra $5,000 to cover, just some helping out in the wintertime for extra plowing. So right now we've been reutilizing someone from a different department to help out. So that's, it's just a small, I think we, need to likely increase that, but I want to keep the conversation going. I've spoken with the highway. They still feel really strongly that they would like to have that 5th position or money towards that, acknowledging, yes, it's very hard to find people, but they'd like to have that ability. We are burning out our people right now with the weather the way it's been, the constant storms. Sometimes people, we don't realize that they're actually getting up at 3 a.m. and they're out there because it's icing up on the hills, or there's more snow on the hills than there is here. So they have been, 3 people we've been utilizing them or overutilizing them, and that has an impact. So trying to think.
We do have 4 in the budget.
We have 4 in the budget, yes. We have 3 people right now. So just trying to think of other ways. Are there, perhaps we take some of our roads and find a contractor to cover certain areas. I mean, I think all the towns are having to sort of think outside the box and look at other ways, because it's not just Hinesburg in this situation, it's across the board. So.
So I think we've got to start making decisions. So I'm looking at the board, what are people thinking? I think we've got 3 things we're talking about. One is add that 5th person, which is what was requested and justified to some point. Don't add any, keep it where it is, or add maybe a little more for some possible support where it can be found.
So if I heard you right, they're looking to hire another person that would give their head count of 5. Right now they're at 3, so they're down.
They're at 4. We have an open position.
They have an open position, right? So this would add another open position to the group. Okay.
How practical is it to think that we can contract out?
I mean, currently, he's done a lot of outreach to the local contractors. They don't have space in their schedules in the winter because they're all out plowing as well. However, if we, perhaps really did this in an organized fashion for the future, we did an RFP, people had a chance to, we saw what the contract would be, then we might find someone that would, for next year, hold that amount of space to have a municipal contract portion of it. It's a thought. I mean, I think there's a lot of different ways to try to resolve this issue, and I think a lot of towns are trying different ways to cover this lack of bodies that seems to be that we are going to probably have an increasing problem of as the years go by.
Is there any thought as to what kind of jobs you'd be looking at subbing out?
I think my conversation with Mike was just, what if we took a certain section of town or some of the roads and decided this is what we'd want to contract out?
And so I'm not, I mean, all these are ideas that could
Right,
be explored.
absolutely.
It seems like if we contracted something out, they're going to be using their own truck, so it's not going to be at $16 an hour. It's
Right,
going to be
there's a
at
cost for
$50
that.
an hour.
Yeah.
And we have the trucks now, we have the facilities, so, you know, I could see contracting out things we can't do or can't do efficiently.
Right.
But plowing the trucks, we've got $1 million worth of equipment in a $3 million building. So that doesn't seem like a good approach.
Yeah, that's what I was thinking.
So again, I'll give my opinion. You know, exploring a fifth person, I think, is something we could do, but I'm not sure this is the year to do it. And I think I would focus on what will it take to retain 4 people. And if it takes a little bit more money there, then we'll have some people there that we can count on. And if we were to hire somebody out, maybe it's a part-time person who also drives our trucks and can help do coverage during sick time or a little overtime on the weekends and stuff.
Yeah, I agree with you, Phil. So I support what you're saying. It makes sense to me. Let's forget about a fifth person for this fiscal year, even though it's probably essential that we do it, but maybe put a little extra money into the salaries for that 4th position that still needs to be filled, and maybe the salaries of the people that are working there now, so that we can retain them.
How long has the crew been down, a person, for the 4, been down to just 3? How long has that been?
Since November right now.
Okay.
But last year, they were down 2.
Yeah.
They only had 4 for a short period of
Yeah.
time.
Yeah.
Oh,
Yeah.
So last winter, I think they were down to 3 people. And it's not good. We all agree that.
Right.
It's not fair. They can't have any time off. They're always on call, and they're putting in outrageous hours. And if you look at the payroll, you can see the overtime in there it's, you know, it's not a money thing. It's how many hours people have to put in to maintain the roads. So back to the 5th person. I want to start getting to a point where we're making decisions here.
Do you need a motion?
No, well, we could, I suppose,
direction.
but, yeah,
Not really.
direction.
Yeah.
I'd support what you say, Phil. I think we're having a hard enough time keeping the 4th. Putting a little extra money in there to support the people we have, or find some part-time help as it's needed, I think is the right move for this year.
And you were thinking about putting in 10 or 15 or?
Yeah, right now for a placeholder, I just had an extra 5,000 in there, but I think we need more than 5,000.
So I'd be all right, 10 or 15, put it in there. Let's see if that, you know, and then, you know, let's decide how to use it. And maybe we put it under contracting. Is there a line like that?
There is for, let's see.
It's under different categories, more or less.
Well, like for brush cutting,
Right.
they have someone,
Professional services,
Yeah.
that might be the place, I don't know. Maybe you say professional services and contracting.
there's a lot of administrative things that he's not able to get done because he's having to be the working foreman and
Right.
out in the truck on the road and there is a lot of administrative things with the municipal roads general permit and other pieces of, you know, the grants that there really needs to be someone there in the office working on.
So that might be something, if he's able to let that go and get somebody else to do it efficiently. Might be difficult, but.
Yeah.
And while we're on highway, do you want to talk about capital transfers?
Yep, so let me get to that. This goes. So when we talked last time, just sort of in order to get to the place that you were wanting to get to as far as lowering our overall expenditure increase, we discussed reducing the 2009 international savings towards replacement from $35,000 to $25,000. And then with the case tractor, we'd started last year or in the current year saving towards replacement. And in order to cut some costs, we decided instead of adding the $25,000 or $35,000 that was projected for this year, we would use $20,000 that we had in reserves and then only add $5,000 towards the replacement. So again, it's getting us off track of that goal of saving towards replacement. Obviously, we can't do that because we can't do that immediately. We're starting that trend and we'd have to really stick with it every year to get onto a cycle where we're saving ahead. So just wanted to kind of really get a sense, is that the direction you want to go? Back to pay-as-we-go system?
Reducing the, we had said, let's start to transition to putting some capital away, because at some point, leases and own-to-lease processes, while now somewhat cost-effective, may go away or may be more difficult. So we've started that, and now we've kind of taken a step back this year a little bit on these two items.
Based on what you were proposing
Right,
for, yep.
where it is now.
Yep.
With regard to the tractor, he's buying a new one, do we even know what the payment is on that?
Yeah, so it's going to be approximately the 22,000 range, 22 to 23,000 range. That's why I reduced it to 5,000, so that we knew we would definitely have enough to cover that first payment.
So since nobody else is speaking, I'll speak. While this isn't ideal, again, this year's budget is still significant, and I think we're forced to squeeze this a little bit.
I do want to remind you, obviously this is your decision. I do want to remind you that, as you're talking to other folks or people are talking about this, remember the municipal portion of the tax bill is 26% of the tax bill. So what we do, highway, police, all of our town services, all are a small portion of what people pay their taxes on. The cost of doing business continues to increase, but our grand list isn't growing. So we're going to continue seeing those increases, not because there's any fluff in the budget. I think you can go through, and hopefully you have gone through line by line. There is no fluff. A lot of these are payments or fixed costs that we don't have control over. And so for me to find money, find savings, it's going to this capital plan, or it's going to the salaries and reducing how we're reimbursing people. We're asking them to do more every year, but in order to find cuts, we're going to either say we're going to pay them less or give them less incentives, financial incentives. So it's worth repeating. To just kind of keep that in mind.
And I'm also wondering, as you're talking, so our tax rate originally was going to be 8% higher. I think you've got it down to 7%. Is that right?
Well, I've got it. Let me just get to.
Well, my point is that I don't see that we've had really increased costs this year. I think maybe what happened. We got something when the school merger happened. We had a decrease in costs. We had a little benefit from that, and we don't have that now. I don't see anything else that's happened this year that I can point to. That's why the taxes are higher. And I'm not sure that there's anything in the future that's going to be, oh, well, we're going to have that reduced expense, so that's going to help out with the taxes. So I feel like with these cuts, in some ways, we're kicking the can down the road. We're not really, maybe we're not making the best decisions because we're going to have to pay for these things anyway. Not with the fifth position for the highway. Yeah, I'm fine with not putting that in the budget this year, but with some of the equipment, we have to have it. So I guess I'm not really seeing effective ways that we can reduce the budget anymore. I'm not really in favor of reducing salaries of town employees. I don't think that the salaries are huge.
We're not reducing salaries.
We're reducing the increase.
We're talking about the increase, right?
Right, yeah.
Well, so let's go back to the capital. What are people thinking? We've got, I think over the years have boosted up the capital. There was a time years ago when it was like, we need a new dump truck, and you put out the money for the dump truck. And, we've gone to a point now where they're in a regular replacement. Those dump trucks are, they're not, there's no question they're in good shape and running well. And now we've tried to start saving for them. What I'm saying is this might be the year we can't save everywhere we want to. And so you're right, in a way, we're kicking the can down the road, but that's what you do sometimes. But what are other people thinking? Because we've got to put this in the budget and decide on what we're doing. And I think you said you don't like that idea, so that's good to know.
Yes, because maybe we just have to have a higher tax rate this year. Because we're not going to do it this year, we're going to put it off for another year, but what's going to happen in another year that's going to change anything?
Well, hopefully the grand list will grow a little bit, and that might help, so.
Okay, is that there in the, can you see that happening? And are there houses being built, people going to move in, and Haystack isn't going to be happening next year?
No.
So I'm not seeing this happening next year, maybe in 5 years.
Yep.
I'm just going to throw this out there for the sake of discussion. That after budget season, I think we as a board, the most important thing besides the wastewater that we need to look at is how do we grow our grand list? Because we devised a town plan that called for growth to cover some of these increases, but that growth hasn't come. It's not being even proposed at this point, as far as I can tell, which is really quite concerning when I see growth in almost every other town, at least in Chittenden County. So we've planned for this, but we do absolutely nothing to promote it. In fact, we actually, some folks, some entities, some whatever, work against any growth. And we can see this year that it is really starting to hurt. Because we have the new police station, we have all the new buildings, which are great, and they were needed, but we need help paying for it. And if we don't get that, I'm really concerned where we're headed. So I think my proposal is, after budget season, is really sit down and figure out what we need to do to promote a sustainable level of growth in Hinesburg. As far as the budget goes, I'm with Renee. I mean, I really don't see, we can't kick our people out and cut their pay. We can't reduce the services that are, we could reduce the services that are expected, but I don't know if that will fly. So unfortunately, I think we're at where we at for the most part. Unfortunately, I just don't see anywhere else where we can trim a whole lot, but I'm open to suggestions.
So if you go to the bottom of the Excel spreadsheet that I sent you.
The PDF?
Nope, not the PDF, the actual Excel version that I sent you, it's in the email,
Yeah.
yep. That I have different formulas down here
Is it in the
showing
Dropbox? It's in-
what, again, what on a $100,000 or $200,000 home, $300,000 home, $400,000 home, what the increase is over FY20 currently, and then what the total proposed municipal taxes would be based on, it's all tied into where we're at right now. On the far left-hand side at the bottom of that spreadsheet is the fund balance as of 6/30/2019. And then I also have the unused that we had proposed applying to the fund balance to offset the tax rate in the current year. And because the grand list had grown a little more than we had anticipated, we didn't apply that. So our total fund balance as of June 30th, 2019 was $604,930. What the select board policy you guys made many years ago, we would keep between 7.5% and 10% fund balance to cover, expenses. And so I've factored in for FY20 expenditures, what 10% would be, what 7.5% would be, as well as where we're at on FY21 expenditures and what that would be. So the available fund balance I used was based on the 10% of the current FY21 that we're proposing, which would give us, it's the most conservative thing. So that would be $186,208.93 that we'd have available. Again, I think I mentioned it last time with the highway garage bond. We came in under budget. We haven't closed it. I haven't closed out that bond yet because there's still the floodplain restoration funds. Once that's utilized, we will have money that's going to be returning to our fund. So that's not accounted for in that fund balance.
That goes into the fund balance. And about how much do you think that might be?
I have the total figures. I don't know, maybe around 250,000.
Okay. So that says
Or at
our
least.
fund balance is pretty good.
Yeah.
So if we apply, and so I can't find that sheet. I think I had it at one time.
Yeah.
You emailed it to us?
I did, yep.
And how long ago did you email it?
I can't find that either.
I've got something on last Wednesday. Draft budget spreadsheet, is that it? PDF version?
No, probably over the weekend, maybe? Not sure.
Yeah, for some reason, I don't see that.
It was in one of the emails with
And maybe this
maybe the
one that says
Dropbox link
Dropbox.
or something.
I know I looked at it,
Yeah.
and it's not in that one.
One thing you did ask, Phil, what a penny on the tax rate is.
Yeah.
And
Oh, here it is. I found it.
based
Thanks.
on what the grand list was at the 411 it would be $62,413.21.
So it's grown a little bit,
Yeah.
yeah. So based on, and this budget we're looking at what percentage of a tax increase? The one that you gave us?
Yeah, I mean, I don't have the percentages, you just have to take the, it's a little over 5 cents on the tax rate, so I could figure it out.
Yeah. 6 times 5 is 30, 300,000.
I still don't see that email for some
You don't?
reason. No.
Uh-oh.
What day was it sent, Phil?
Hold on.
I've got one that was
I
sent
pulled it up. It was sent on the 13th.
It's
Monday.
It
yeah.
says Dropbox link.
Yeah,
And then in there is
1-15, and it's
the
attached to it.
embedded.
The only reason I sent it is because Dropbox really,
Right.
the Excel gets a little
Did you find it?
wonky, and
Wow.
so I sent it to you as a,
Yeah, sent on Monday. With the Dropbox link and an attachment, and it's the attachment.
Can somebody just forward it to me, because I don't have
Yep.
it?
And it's just FY21 proposed budget. Version 3 draft.
yeah.
So I'll just say 5 cent increase. It's the biggest one I can remember. So it's a significant increase.
Oh, I sent it to your Gmail by mistake.
It doesn't, it should pop up if it's.
So while we're doing that, we had a discussion about the capital. What are people thinking? I heard from Marilee. I'm not sure what you said. Do we put the money back in the capital, Tom?
For- how much
for
did
the
she
two
take out?
items for the highway? We reduced it from 25 from our discussion last week.
So it's
So many things I've got opened here.
capital for highway.
Did you get it, Tom?
I did, thanks.
It would be here. So
that-
yeah, so we had the 2009 International we're saving for, right? And we had savings toward replacement. So now we had 25 in there? Is that where we are now? Sorry.
So right now, we have 25. We had proposed to have 35 in the FY '21.
So we've reduced it a little bit.
Yeah.
That's savings for replacing that dump truck. Then we had, how much in the tractor? We had 25.
25.
And now we've reduced that to 5.
Yep.
No, thinking we can make that first payment.
Yeah.
Lease.
Yeah.
Yep. And you were asking what the percentage tax increase based on the rate last year and what we have right now, it'd be a 9.6% increase.
9.6%.
We were higher than that when we had the highway garage bond and the solar trackers. Again, it was fixed costs and debt service.
Right.
And that's why we offset it with some fund balance.
Yeah.
Which we didn't end up
Needing
to
right.
use.
When was 9.6%? This year?
This year.
What we have proposed right now,
I thought I saw 5 something.
Yeah.
that's the increase of expenditures from last year.
Oh.
So
Then
the
you're
revenue didn't grow enough to offset. So if you take the tax rate from last year, so right now the difference is 0.0509, and the approved tax rate from the current year was 0.5296. So you take that difference, divide it by the 0.5296 times 100, and you get the 9.6%.
Wow.
Ugh.
Another way to look at it is there a number that we're comfortable with? Is it, it has to be 0% increase, or is it a 2%, is it 4%, or is there a number that is a threshold that we're uncomfortable with, that we're trying to get it down to? In other words, should we be looking at this instead of like this item or that item, but like looking at it from a number and trying to get to a number?
I mean, for me, I end up looking at what's the final number,
Right.
but I look at what's the service we're providing and what's the least amount of money we can spend to provide the service we think people need.
Yeah, but I mean, like, we're doing it that way, we're looking at it that way, and we make justifications for every item that's on there. I mean, you could, certainly, so that still doesn't get us down any, so we're still at 9% or whatever the number is. So I'm looking for a way to make hard decisions, and forcing us, well, hey, look, we don't have any growth, so there goes a truck or something of this sort. That's the consequences. Because we're trying to hit a 2% increase instead of a 9% increase.
I don't have a set number in my head. I look at it and I say, we could save there. But I don't hear the rest of the board chiming in, so if we want to go with what we got, you got 4 votes, you can go with it.
Yeah.
That's the way it works.
I don't know, it seems to me that we should cut things out because we don't have growth.
No, I'm kidding.
You know, and that's a way to get everybody on board with realizing the pain of what we're trying to deal with.
And that's
you
what
know?
I've done. I've gone through and I said, I think we can trim this, and I've also said, I think we need this. So,
But even on the things we think we need, maybe we shouldn't be getting those either.
So we have made some cuts in previous meetings. Is it still at 9.6% increase?
Yeah, this is live. This is all
Sure.
based on where we're currently at.
Is that with the fund balance reduction or no?
No, there's no fund balance applied here.
so we can.
I think we need to do that.
It looks like we'll be able to apply some fund balance, a couple $100,000.
Yep, if we want to apply, so what we talked about before is hoping to be able to do some capital projects. But if you want to offset the tax rate, then yes, you can use that. If we're going with wanting to keep 10% of the expenditures that are fund balance, that we would have available to utilize is $186,208.93. So, and again, a penny on the tax rate is $62,413. So 124,000, 25,000 would be 2 cents.
It's a significant step in the right direction.
Yep.
I can show you what that looks like if we applied 125,000. So now that's 3 cents increase over last year. Just over 3 cents.
Instead of 9.
3 1/4. What's that?
Instead of 9, you're saying? Now, what do you say?
This is the pennies. This is the pennies.
3 cents. Yeah, it's not a percentage. It's,
So, okay.
Right.
yeah.
Yeah.
And we could figure out how much that is for a $300,000 home.
So on a $300,000 home, the difference from FY '20 is $93.06 per year, or $7.76 per month. On a $400,000 home over FY '20, it's $124.08 a year.
This is with the capital, using the capital funds?
No, this is the
This is
capital
when
funds was reduced. in
So I
this one,
just,
right?
yeah, the capital funds is reduced, and this is utilizing $125,000 of fund balance to offset the tax rate.
That's what I meant to say.
Yep.
Okay.
So
Yep.
in this budget, some of the things we've talked about, it has, does it have the 2% or 3%?
It's a
for-
combination, because we have union.
Yeah,
it's
so
3
forget
for
the
other
unions,
is a
we
2.
can't do anything
Yeah,
about that. So
Right,
the other people are at 2%.
yes.
And to go from 2% to 3% is
Around 10
$12,000.
around- Yeah,
$10,000.
so.
So that's that topic that you're saying. So that's what that is. To go to 3% is 10,000.
Pretty convincing.
So let's, we need to make decisions. What are people thinking? So I had put that out there that we could reduce the percentage, but you're talking $12,000.
Another way, instead of doing a percentage across the board, is, maybe say everybody gets a 50-cent increase or a dollar increase. So everyone's getting the same increase, and it's not based on the higher salaries get more than increase, because on a percentage, the higher salaries benefit the most.
Yeah.
And whereas a straight dollar amount or, figure
Right.
goes evenly across.
Sure. I mean, so I also said, if it was 2%, and I would say the same thing at 3%, we budget that 3% in, and we allow Renee and the managers to then move that around. So somebody who's making $75,000 might not get 3%. Maybe they get 2. Their work is okay, and but 2% on 70,000 is a good amount. And somebody who's at the low end, who it's difficult to keep people, but is doing a very good job, could get a 4%.
Yeah.
So rather than just sort of say everybody gets the same, we give that pool of money, and pretty much everybody gets the same, more than likely, but there might be some discretion there.
How do you feel about that, Renee?
As far as,
having that flexibility, because it could put you in an awkward position as well.
Yeah.
It's the position the manager should take. Right.
Every
But,
position
sorry.
is an awkward
Yeah.
position. It's, but I think at least applying a set amount to each person's increase, that eliminates that offset of the higher salaries benefit the most, and it's not tied to performance or how a person does. It's just we get 3% across the board, and whereas if we do 50-cent increase or a $1 increase, then it's more uniformly done. In order to tie it to someone, the performance evaluation and things like that, then that would be more discretion of the person in my seat. Yeah. So it would have to be a clear reasoning or rationale, based on the performance evaluation, sort of what equals. So it's not, so someone in my position isn't like, oh gosh, someone could look at it and think, oh, they're giving this person more, so you have to be really careful about doing it that way, and it would have to be very clear, a basis of how that, so it's done uniformly.
Yeah.
What would you prefer?
I think if we do whatever you guys are comfortable as far as the increase, and then as the performance evaluations go, can look and see, does this make sense? I don't know that I can tell you today that I have a uniform way to deliver that, and I certainly wouldn't want to do it unless I had some clear basis for doing that, because I think that would be chaotic and wouldn't be well received, and I'd be chased out of town right away.
But if we said 2% increase, and you said, well, I'd prefer to have it be a $1 increase, 50 cent, whatever you said, across the board, you'd have the flexibility to do that.
Right.
If we say 2%
If you said 2%,
increase.
yep.
So you can interpret that in the way that you feel works best.
Yeah.
But you could do the same with 3%.
I could do the same.
Yes, but you're advocating for 2%, and I'm trying to agree with you.
I don't know, what are other people thinking? I mean, I'm not
pretty,
stuck on it.
It's pretty convincing, the savings.
I like the 2% with some flexibility.
Yeah, agreed.
I mean, it doesn't mean it's 2% forever either.
Right.
No, but
Is it possible to do the 2% with flexibility? And Renee, you can decide whether you want to go down the performance review amount versus the dollar amount you're talking about. But you,
That would be the
because I would
flexibility.
trust you as the day-to-day manager to
Yeah.
know what's
So
best for the
that
town.
2%, then there's a dollar figure that's associated with
Yeah.
that. And so when the time comes, I know that we've been approved for at least 2%. That's factored in.
So if it's $12,000, and how many full-time employees would that apply to?
18, depending on what.
That is not even 50 cents an hour. If that's how it works.
So.
How much an hour?
Pretty small.
Again, it's based on what the salary is.
Right.
So the higher salaries get more of that.
Yeah, it seems like
increase.
12,000, it seems like it would be more than that, but, so I think it sounds like we want to give that flexibility. Everybody would like to do that. So the question is, how much do we do? How much do we put in?
I think your 2%, raise of 2% rather than 3%, I'm okay with that. I think that's probably necessary.
part of my justification was the cost of living, which is pretty low right now in comparison to many other years. And also, we're taking a big hit on health insurance.
Yeah, and we're
So-
paying a significant amount of, what did you say, 85, 90%? It was,
It's 90.
What's that?
that we pay of the health percent. Employees don't pay like 50% of their
Yeah,
cost.
so for union, we pay 85%, they pay 15. For non-union, we pay 90%, they pay 10.
Wow.
For
good.
platinum, for
And-
the best.
I mean, I also did put that on here too. You know, you can look at the employer-employee mix too. So the salaries are something you guys mentioned. You also, I heard you mention the health insurance and that portion. So that's here as well as a discussion point.
So just, I don't know if you can do this off the top of your head, but say we followed the unions and we gave a 3% increase, but we had only 85%. I mean, 85% is still huge for the health insurance. Would that balance? Would we have the same amount of
I've got a
cost
spreadsheet.
reduction?
I've got a spreadsheet for that. I've just got to remember where.
She sounds like Elizabeth Warren.
That's a complicated one
Yeah.
because
Yeah.
some people, the health benefit it varies for each employee depending on whether they have a family or they chose to opt out.
Uh-huh.
So that starts to put more responsibility on employees for what they're signing up for,
Okay.
which is what everyone else is doing out there.
That's what that was
A
what I
higher
thought.
percentage.
Yeah.
And I think I've described what my company does, says, here's how much money you get, buy whatever you want. You want to buy blue, you want to buy gold, you want to buy platinum, go ahead. But here's the amount of money you're getting. You're not getting a variable amount depending on what you ask for, in a way, or maybe what your family needs. It's a little different. I think it's quite good, and that's a good thing. That helps us keep employees and make us a little more competitive. So my preference would be, that's something we can look at, but this year, I think it's a complicated topic, and it's a big change, and we would need to know what the impact is for all the employees.
Okay, but it's
By paying another 5%. So for them we know what the average amount of health care is, and I'm going to say it's probably in the 20,000 range.
Yep.
So you're asking for another 5%. 2 times 5 is 10, another, be more than $100. It's not 1,000.
So it sounds like we have options in terms of healthcare, like your company does, Phil, a certain amount of money. I haven't paid that close attention to the other options for the healthcare, but another option might be a less than platinum plan, but we cover some of the deductible. And I don't know how those numbers wash out.
And we're saying it's too complicated this year to do maybe it's not a 5%, where we pay 90% today, correct? What would it be to drop that to 89 or 88? A couple percentage points. Is it minuscule or is it,
So, let me just see. For MVP, I'm trying to see where I did this.
So if we drop, somebody's on the family plan that's worth $27,000. If we dropped it and they got to pay, instead of getting 90%, they got 85, that's $1,300 they would have to pay by dropping it 5%. I've seen other companies do what you're talking about, but they do it over time.
right? That's why I'm thinking a lower than 5%, but it sounds like it.
But, I mean, I'm for that. I just don't think we're at the last minute here to come up with a plan.
Yeah.
I think we got to look at what I think that's well worth doing, saying, hey, we're going to get out of the healthcare business, or not tie the town to the healthcare crisis so much. So therefore, over the next 10 years, we're going to decrease healthcare coverage, but increase salaries, the same amount. And then we start to untie ourselves to this healthcare crisis, the town. You know, but that would be a good approach, but I think it takes a lot of thought, and it takes some advance notice.
Yeah.
That's what we're doing. And same with dropping the percentage we do. I think it's something we should be talking about, but I don't think we should talk about it in the middle of January.
Right, so you're suggesting that it's too late to do that now, just leave the health care alone? Okay.
So with regard to healthcare, there was a pretty good increase, but we went to MVP. Is that because of the employee mix?
Yeah, it's completely because the employee mix. Actually going to MVP is almost exactly where we are in the current year with Blue Cross Blue Shield, even slightly pennies less.
Even with the increase of both of them, we jumped over here and that dropped us a little bit. But now the mix, more family plans. And that's going to continue because we have such a good plan. If your wife or your husband's working somewhere else, if your wife worked here, you'd say, hey, let's jump on the Hinesburg plan.
Yep.
Because it's better.
Yeah. So we had, every year there's changes. Either someone gets married, they have a child, or a new employee comes on, and so where we weren't paying for a family plan, now we are. And then we've had existing employees move from the opt-out to opting in, just like Phil said, so.
Right now, we're providing a really good plan, so we're attracting. Companies are trying to do the opposite, so people go, why don't you go on your wife's? Their plan is better.
That has been.
That's why the one the model that I have at work is a good one. It's like, here's how much money you get, no matter what you do.
Right.
You're on somebody else's, fine, you keep all the money.
Because our salary isn't always competitive, the health insurance piece is at least something that we can.
Right.
Yep.
That's why I don't think we should
Yep,
shake
okay,
that
so
up
let's
too much.
move on then and see what else we can do.
I'm sorry, real quick. So you dropped down to 124. I'm seeing the difference from the FY20 to FY19 to 20. Oh, you had it down there where it showed the a $400,000 house went to 124, I think.
That's if we applied the fund balance.
That if we applied.
balance, yes.
So what percentage increase are we at with that?
So now 5.85% increase at tax rate.
And we really want to be what, 3?
That's,
You used to be able to depend on significant grand list growth. And
Or
that's
some
just
grand list.
Yeah.
some grand list growth. I mean, this is by far the lowest Phil and I are on here the longest, and it's never been great, but it's been better than this.
yeah.
But to get to Phil's point about what are we gonna do with the budget? And errands, we either need to cut something big, like a dump truck, and police cars, or we're kind of stuck. And part of me wants to go to town meeting and say, okay, folks, here's what your expectation has been, here's what it's gonna cost, and here's why.
Yeah.
That's kind of what I'm thinking.
That's kind of what I'm thinking.
Yeah.
I really am at that point.
Well, I am too, but there are some things I think we can look at and ask questions, because when I do go to the town, I want to say, hey, I think we've done everything. So that means going through the items. And
you wanna start
so
from the
I
top?
put out there again, what do people want to do with the capital? We've trimmed the capital on the town hall, on the highway or not?
Yes. Yeah, I'm fine with it.
Okay, so there you go. So we're going to do that. Is there anything else on the highway budget? I don't think there was. We've already said we're not going to put in the third person, but we did want to add a little bit for contracting.
Yep.
To see if there's an opportunity there. Were there any other questions you had, the things we talked about?
No, I mean, just going through line by line, as far as anything that we can really, what we can play with or manipulate, a lot of it we can't, but the limited number of things that we can are really, again, the salaries the health insurance as far as the mix. And
This one that we're
This
looking
capital.
at before still shows the Lake Iroquois at the higher,
No,
no, 75, you're right,
no,
that's the
it's
new one.
75,
Right,
yeah,
right, okay.
yeah, so that's reflected
And
in
the
there.
Energy Committee.
The Energy
and-
Committee, we reduced that, that's
Yeah.
reflected in here. The HCRC coming back with, rather than 25,000, 21,000 is also reflected in here. So I think I've captured any of the changes. The wall contract did come in, so this is, instead of the 30,000 at the cemetery, it was actually 31,
Yeah,
215.
and I see the workers' comp drop down. Good job there.
So, yeah, I mean, as long as we stay on target,
Yeah.
it's,
And the HCRC,
yeah, so they came back with the 21,000
Yeah.
versus the 25. If you go to the last or the last tab, the major drivers and increases, I think I've reflected all the changes I keep, doing here. But I have, on the top half shows all of the increases of 5,000 or greater, and the bottom half shows the decreases of 5,000 or greater, and details out what those are, what department they're from, and what line number.
Was Green Mountain Transit going to come in?
I don't think so.
No,
I could provide some information like ridership and.
Yeah, I'd be
things.
I think that's what you had
Yeah,
said,
I
that you would
think I
just
may have said
provide that,
Yeah,
yeah.
so I will do that. I think it dropped a little this year, but the previous year it grew quite a bit, so over the last 3 years, it's shown an increase, 4% or something.
Yeah, so I adjusted it, so it wasn't quite 4%, it was a little under 3.95%. I adjusted what the actual, when they sent their information.
request.
So this is the 46,770. It's the actual amount in the request.
So Green Mountain Transit's right in the process of significantly reducing their budget in different areas. This is sort of a funny line because it's the combination of the two systems, Middlebury and Green Mountain Transit. Were there any other, again, I think I might have asked this, were there any other ones that we discussed or had questions about that we could clarify so you can sort of start dialing it in?
You wanted me to add in, so the fire employees, so that's
Yeah.
reflected in all the health insurance, so the health insurance line increased a little bit, so did the dental and vision and all of that, so those associated costs, as well as retirement, factored in that additional employee, and so those figures increased from last week.
It was, I think I was one saying, I think it's time to do that.
Yep.
I mean, we did hear it from Charlotte, I think, saying, that, and when they said, and while they're not out on calls, there's a whole bunch of stuff that can be done. That was good to hear. That reinforced that justification.
One thing that's important to note, while we have this bottom line here, you still have conversations over the next 2 weeks that are going to determine, we know it's going to be more than this
Right.
because the ambulance, there's a cost regardless of which way we choose to go. There's a significant increase that's never been in our budget before.
Right.
So
So we're looking
that's,
at about a minimum of about $140,000 increase in EMS. Between the person.
No, if we contracted it out.
if we contracted it out, it's still going to be.
I'm sorry, about 90 on top of the 50 that's already in the budget.
Yeah.
I mean, rough math.
Right. Yep.
That's if we contracted it out, or if we...
Using their numbers that they proposed tonight, assuming there's no negotiation or anything.
Yeah.
Right, yeah.
It was 52 for Charlotte and 35 for Richmond, so
Okay,
almost $90,000.
Yep.
okay.
Right.
And if we start working with our own, wasn't it like 100, at least 150,000? Was significantly more.
Our own?
Based on.
Way more than that.
Yeah, well, I mean, based on what the, with the person who did our proposal, the net, what's in your thing is like 153,000, I think. And that takes out the revenue. So you have the total expenditures and then takes out the revenue as well as, what we get from St. George and all of that. So what it doesn't include is building costs. So it doesn't have the capital. This is just a 1 year, get it off the ground budget that's going to be presented next week.
All right. I would suggest we all take another good look at I don't know, we have this one. I don't know if you want to send us out version 4. Maybe that shows some of that fund balance in there. It's in there now.
Yeah, it's in here now.
So, but that you modified that as we were talking, right? Or
The
not?
fund balance?
Yeah.
No.
Oh, okay.
I applied fund balance. Is that what you mean?
Yes.
Applying fund
Yeah.
balance on the revenue
Yeah.
side. So
Yeah.
on the revenue side, I applied the 125,000, which is what changed the tax rate.
What does that bring our fund balance down to?
No,
Is it
it's not the fund balance, it brings the tax rate down, the
Right, but
proposed tax rate.
Of the $300,000 to almost $400,000, I can't really see it too good.
So it brings our fund balance down by 125,000.
Right, but what percentage? Because we talked about percentage, 7.5% to 10%.
So the
we wanna
tax
keep.
rate right now is an increase of 5.85% with that applied fund balance, that 125,000. 5.85.
No, I'm talking about the percentage that we have committed to keep in our fund balance.
Oh.
So if by applying that, what does it leave your estimated fund balance at?
So, I mean, that available fund balance doesn't include, we were keeping the 10%, so 10% of our.
Keeping 10%.
Yes.
So it's pretty conservative.
And that doesn't even use all of the extra from the
Right.
10%. So we still have definitely, an appropriate amount of fund balance. And again, it doesn't factor in what will be released from the bond bank when that project gets
There's more there.
finished.
So that's, I would say, from our best knowledge, it's very conservative.
Yeah.
So we shouldn't have any issue about that. And that would be a warned item where we would apply that. But we always make a final decision later when the tax rate is set,
Yeah,
right?
it wouldn't be a warned item more than it's what you're doing in this process right now. So it'd be part of the budget you'd be presenting to the voters.
Yeah.
So it's not
Yeah,
a
isn't
separately
that
warned.
its own article to apply?
No.
It's not?
Not for this. If we were to use it towards capital project, then we would have it as a separately warned item. But how we've done it with this, it's just in the revenue applied fund balance. We have a line item for that. And then in my memo that I would do, that would be in the town report, it would talk about the applied fund balance and detail that out.
So, and then, correct me if I'm wrong, when it comes time to setting the tax rate, when all these little fine numbers get set, if we wanted to apply more, we could, right?
Oh,
Yeah, anytime.
well, I mean, this is what you've proposed, obviously, I mean, we have fund balance, but this is what your budget that's proposed is, it's based on that amount of revenue coming in, revenue coming from fund balance. So it's shown as revenue.
Right, but when we go to set the tax rate, which is later, if we wanted to apply more fund balance, because we've got stronger numbers and you've brought the highway money in there, we could do that, couldn't we?
I don't know that we could if we haven't discussed it with the voters at town meeting. I'd have to clarify that.
Do we have to tell them?
I would have to clarify that.
Okay. I always thought that we always had that final discussion about the fund balance.
Yeah, I mean, you.
Because in the
certainly-
past, haven't we not used it?
Yeah, we haven't used it.
And we, because the tax rate wasn't that bad, so we said, oh, let's not use it.
Right.
Even though we had said we were going to use it.
Right. Yeah.
So, Yeah, it would be good to get clarification on that. All right, so I would say we have the latest copy. Let's all take another look at it, because don't forget, it's gonna get fatter by 100,000.
It's a lot.
Yeah. When we add in contracting out, or whatever we add in, contracting out or moving toward our own ambulance.
And will you resend that to us?
What's that?
The thing that's on the board right now? that
Yeah,
you've
so the only
updated?
change I've made is the supply and the fund balance, but I can certainly send that to you.
Thank you.
Next week is warned the public hearing on our capital improvement plan, so I put that warning in the Citizen. So that's the budget meeting that we always discuss the capital plan, make any, finalize any changes, and then that's the capital plan that we put forth. So if there's anything different that you're wanting to do, I need to know that so that we can make.
It would be great if some of the community showed up.
I know.
It's not gonna happen.
Right.
But it would be great if people would at least chime in and say, what are we doing
Absolutely.
right? I guess they get their crack at it at town meeting, but.
Right.
Yeah.
Yeah.
Yeah, I agree.
Can we do a survey?
What would you ask?
I know it sounds crazy, but
What would you
survey.
ask?
Take a pulse, what works, what doesn't work, what services are good, what services are not. I don't know. It's an idea. Just giving ideas. It's my first time. I'm still learning the budget process here. You picked a great year.
So, and people should start to be thinking about, next week, we're gonna talk about what the costs and how having our own ambulance service would be. And for me, one of my questions is, if we wanted to move that way, how do we transition, and does that transition talk about contracting while we transition? So that's just a thought that I've had. So everybody should be thinking about that. And then how do we present that budget, whatever it is? So if we contract out, do we just have another warned item that says our ambulance runs out in June 30th? Here's a proposal, contract it out. Bingo, here's how much it's gonna cost.
That's a good question, because I wonder how we would present that. Because I don't imagine our fire department would want it under their budget.
Right. I don't think so, maybe.
A separate article? I don't know the answer to that,
Yeah,
but
I would
it
think a
might get
separate
messy.
article, then you have that really good discussion about the ambulance. Or we could present, the other option of, here's another warrant article that says, we get our own ambulance, and during the transition time, here's what it's gonna cost, or here's what that first year is gonna cost, here's what the next year is gonna cost, and there may be some contracting out in the meantime.
The other thing is, and I haven't done it because it's going to require a lot of work, and I will only do it once if we're going to do this, is under the Hinesburg Fire and Rescue, maybe have Hinesburg Fire, and then the next half be EMS or whatever, and so have that total EMS budget. So it still fits with the same format that we have everything else in. Again, that's a significant change, so I want to wait until we've decided which path we're going, or if we're bringing it to the voters.
So if we said we're going to contract out the ambulance, would we give a time frame on that? Like you said, would we say we're going to do this for 2 or 3 years until we get our own ambulance up and running, or would we say we're going to do this for the foreseeable future?
I don't know.
Well, you both said it was year to year, whatever we
Yeah,
decided,
right.
whatever worked
Yeah.
for both, so.
Yeah.
What's that?
They both said it was year to year.
Yeah.
Okay.
That's what it's being presented to us as.
Yeah, and that's what each service did say. I mean, they aren't,
They're not committed.
they'll support us in whatever way we want to go, so.
Well, that's not going to be satisfactory to our EMS group. They want to know whether in the future we're going to support them to have an ambulance.
Right.
Right, yeah.
So I think it was nice and calm tonight, but I don't think it's going to go over too well if we say, okay, we're going to contract out for a year and think about having our own ambulance sometime over the next year. We're going to come to a decision about that.
Well, I'm going to make my decision on what I think is best, not on how people are going to react.
Right, but I think we need to formulate it in some way where that decision is made. So if we decide that we're going to put it in front of the voters, here's the budget. If we go forward with our own ambulance, here's the budget if we contract it out. Then we're at least coming to some clarity.
I think that's what I said, but yeah, I agree.
Okay.
So that, and I would think that could be a warned item.
Yep.
So there's a discussion about that. Because either way, do nothing, contract it out, or hire an ambulance, we have our fire and EMT budget established, and that's not going to change no matter what we do.
Right.
And can you, in advance of next week's meeting, can you look at the proposed ambulance budget? Do you have questions, or is there any clarification you need? Let me know so I can work on that.
I think it's coming out pretty good, and it's, dialing in the revenue and all that. It seems pretty good, and I'm assuming Al and his team has looked this over and say, yeah, that's it.
Yeah, so because I have been emailing back and forth with the consultant, we've been checking on things, reviewing it, I still have to bring this and talk with Al about it.
Okay.
So he hasn't gotten a full look at it.
But he's seen
a lot of it, yes, but I just want to be able to share that with him too, just like Charlotte was able to see Richmond's proposal before tonight. Richmond was able to see Charlotte's. We should, just so that everybody can have their questions ready for next week.
So I think you're right, Marilee. The show will go on next week.
Yep.
We'll see how it goes. Next item on the agenda, Town Administrator Report.
Again, a lot with the budget, a lot with the wastewater upgrade and the status of that from the results of the income survey. Still trying to close out the Village North sidewalk, so the contractor has now submitted the first invoice, but because there were some other items that they needed to do, things that they had to do, there's still more of the billing that will be coming. So I've received the invoice and then quickly turned around and sent a requisition to the state so that we get a portion of that reimbursement, and then as well as to the other landowners. So that's in the works. We've a lot of work just, talking with department heads as we focus on this outreach to try to see if there's any other revenue sources that we could find. With the alarm ordinance that we adopted, I asked the fire chief and the police chief to kind of look at the numbers over the last year, but they really felt like those, there wasn't enough information to be able to put a revenue figure for that yet. So just fair amount of things going on. Joy, you've been working on finishing the policies and things with the departments as far as OSHA guidelines. We're wanting to get to where we invite Project WorkSafe to come back. So we're getting close to doing that.
Working on a personnel
policy.
and just working our way through things.
Yep.
seeing that workers' comp drop a little bit is a good sign.
It's a good sign. I
Yeah.
mean, the safety
There's a-
committee is,
That's
it's been a
great.
good thing. We keep it as a regular monthly thing, and I think everybody's bought into to all of it, so.
All right, anything else?
I think that's it.
There's a lot, but.
Yeah.
Select Board Forum? And I don't know that there was any correspondence. There was at least one thing about the ambulance that came in and that you were going to save up till the end.
Yeah, so
have them on.
anyone, I had put a post on Front Porch Forum, if people had comments or questions, that, they weren't able to send them to me. I did get the first one. I'm putting it in the January 29th electronic folder right now, and then so for that meeting, you'll have all of the feedback received, so that before you guys make a decision of which way to go.
We did get an email from Don Francis, I think it was, you were copied on it also, Renee, about our fight. A while back, a few weeks ago. About our police chief, and maybe a 6-month review was talked about.
Yeah. So, I mean, that's something that I do on a regular basis. There's a formal, so with the police, there's a 12-month probationary period. So there'll be a final review at 12 months. So yes, those conversations happen, yeah.
Okay.
Yep.
Okay, good. I just hoped that it would get to the right person, and I guess it did.
Yep.
All right. Any other Select Board info? Is that right if there isn't? Minutes from January 8th, pretty extensive minutes. Is there a motion to accept? I'll make a motion to accept with any edits the January 8th minutes.
I'll second it for you, Phil.
All right. I looked it over. I think it looked great. Thank you very much, Val.
I found one correction, only one. It did look fantastic. So on the second page, the top third of the page where it says Bob Thiefels said he feels that what Peter and Catherine said it should be is rather than it important.
Also, if you go to the first page.
Look who attended the meeting.
Oh my gosh. Oh, could you please correct my name on the attendees?
Wow.
Surprised you didn't see that.
Any announcement here or that we should, no, I guess not.
Our readers would like to know more.
So would the people involved.
Yes. All right, so I think that's it. All those in favor of accepting the minutes, say aye.
Aye.
Aye. That passed.
Make a motion to accept the warrants to include payroll as presented by the clerk.
Second.
Wherever they are.
All right, they're over there, next to the clerk, next to Val. They seem pretty straightforward. They're there for review for anybody. All those in,
Please sign, there's one part about the Parker in one of the books, if you could sign it.
oh, something we missed?
Yes, please.
Okay, we'll do that, yeah.
Is it here now?
Yes, it is.
Was it in there before? Maybe we missed it?
It was, Missy handed it to me today.
Oh,
It's on
okay.
the cover, it's on the front of one of the notebooks,
Got
I
ya.
do not recall.
All right, so
That's
we'll
very
review that.
important, 'cause they do need, that's for the Village North sidewalk construction.
Is it in there, right there?
Parker excavation for $146,000.
Yep.
Okay,
We all need to sign? Not all, but.
yeah.
Just can.
All right, so all those in favor of accepting them, approving them, say aye.
Aye.
Aye. And then we will consider a motion to go into executive session for a personnel issue. Like always, we'll stop the broadcast. We don't make any decisions in executive session. I don't think we'll be making any decisions anyways. This is just to share some personnel information. Anything that we do within that or after that would be reflected in the minutes. So it's the last item on our agenda. So I would make a motion to go in executive session, include Renee and Joy and the Select Board to discuss a personnel issue. And because it's a personnel issue, we don't want to disclose it to the public. That sound all right?
Second.
All right. And then I make a motion, because of that situation, we're going to go into executive session under provision 1 V.S.A. State Statute 313A1, A2, and A3.
We didn't vote on them.
Oh, all those in favor of that first motion, say aye.
Aye.
Aye. And
I'll
then-
second your second motion.
All right, and all those in favor, say aye.
Aye.
Aye. All right. Thank you. I guess we'll do the